All right, we've tested it, but I am going to ask you to pull it down because just when I gavel in, we're going to do opening statements from counselors. So,
sorry, it disappeared for me, but I couldn't tell if it was for everybody else.
No.
Okay.
It worked. All right, well, I think we better get going. Let me just check. Candace, are we good to stream?
We are all set to stream, Madam Chair.
Okay, all right. I think we've got lots of material to cover today, so I think we should get going. So I'm calling this hearing of the Boston City Council's Committee on Boston's COVID-19 Recovery to order. For the record, my name is Kenzie Bach. I'm the District 8 City Councilor and also the chair of the Committee on Boston's COVID-19 Recovery for the Boston City Council. I'm joined here today by my colleagues, Councillor Michael Flaherty at large, Councillor Ruth C. Louis-Jen at large, Councillor Frank Baker of District 3, Councillor Ed Flynn at District 2, and also our Council President, and Councillor Brian Worrell of District 4. And I think we'll have a few other councillors trickling in. This public hearing is being recorded. It's being live streamed at boston.gov/city-council-tv and broadcast on Xfinity Channel 8, RCN Channel 82, and FiOS Channel 964. We'll be taking public testimony at the end of the hearing. So if you're interested in testifying, please email Michelle Goldberg for the link. The email for that is michelle.a.goldberg, Goldberg, at boston.gov. So you can email Michelle for the link. And if you have already signed up to testify, we have you on the list. Some of you I see are here already, and just know that you'll be moved from attendees into panelists when we get to the public testimony portion of the hearing. Today's hearing is on Docket 0194. It's an order for a hearing regarding a review of COVID-19 recovery funds. It's sponsored by myself, Councillor Liz Braden, District 9, who will be here in a moment, and Councillor Brian Worrell, District 4. I'm going to briefly go to councillors for opening statements, and then we'll turn it over to the administration for their presentation, questions, and then as mentioned, we'll hear from the public. I just want to stress for myself that I filed this hearing order because there's an enormous amount of interest throughout the city in how Boston's going to spend its federal funds, how we've already spent federal funds that we've received in this COVID crisis. And I think everybody on the council and the administration side and in the public recognizes this as the unique opportunity that it is. Also, the fact that we are still in a crisis and there are so many people hurting. And so we really all feel the onus to make sure that these funds are being used in the best, most strategic way possible, and recognize that it is a kind of one-time allocation of federal money like we don't usually see. And so we want kind of the utmost scrutiny on that. And so just for anybody who's watching at home to understand, this is not a docket where the administration has filed a proposal for how to spend the remaining federal funds. This is a docket from the council initiating this hearing so that we can get a bird's eye view overview of what we've done so far and what funds are available. And the hope there is that it creates a kind of a shared information base for everybody on the council, the administration, and in the public to operate from as we talk about the remaining dollars. So to that end, I also expect that we'll hear in public testimony from members of the public who have an interest in how we spend these and suggestions for how we spend these. And so just so everybody understands that what we're discussing today is not an appropriation order. It's kind of the bird's eye view question about where all these funds are and what status is. So that's a bit from me. I'll let Councillor Worrell, as one of my co-sponsors, give a quick opening statement, and then we'll go in order of arrival, which is Flaherty, Louis-Jen, Baker, Flynn, and I'll add councillors who as they arrive. So Councillor Worrell, you have the floor.
Good morning, everyone, and thank you, Madam Chair, and to everyone from the administration that's here. Very important topic. And with the historic amount of relief funds being allocated in our fiscal year 2022 budget, it's critical that we have oversight into the execution and success of these investments to make sure residents get the services and support they need as we recover from this pandemic. We should ensure the initiatives launched and programs bolstered by these funds are having the intended impact, and assesses how we can best utilize future and state and federal funds to be allocated to continue to address persistence inequities in our city. I'm looking forward to hearing from the administration about the status and success of these relief investments. Thank you.
Thank you, Councillor Worrell. Councillor Michael Flaherty at large.
Good. Thank you, Madam Chair, for hosting and also for co-sponsoring along with our colleagues, Councillor Worrell and I believe Councillor Braden as well. So as I mentioned when it was introduced, the previous acting administration put together an equitable recovery task force and community engagement process for residents to come forward and provide feedback for how they wanted the funds to be spent on certain crucial areas that have either impacted their communities or our city. And I felt that the sessions were somewhat helpful, but they didn't really reach a wide range of people across the city. So, and I think there's still a lot of confusion out there about how much money we have, how much money we've allocated and have spent to date, and where. So I think it's worth noting that that this body also approved a substantial amount of COVID-19 relief funds during the fiscal year 2022 vote, working with the Walsh administration. Some of those funds were for revenue replacement, as Justin and others can explain, and others were for critical public health resources, alongside with relief funds that could help impacted industries. So I think that the new elected administration may want to rethink how we've communicated with our residents to date, and invite community groups and industry leaders forward to talk about the use of these very precious funds. And lastly, I think the creation of a dashboard, I think that's a great step, and that we should explore if it's appropriate to house this in the COVID-19 webpage that pops right up on the city's website, as well as on the budget page. So we're sort of focused on, they sort of look at it maybe as a budget item. It's clearly, it's on the budget page. If we could put that on the COVID-19 page, anyone that's looking to see whether, one, funds are available, two, whether they qualify, three, whether it makes sense with their respective, whatever the issue is it housing, is it healthcare, is it small business, et cetera. So I think that would be a step in the right direction if we could add that onto the dashboard. So I look forward to the testimony and participating in supporting the chair any way I can. Thank you, Madam Chair.
Great. Thank you so much, Councillor Flaherty, and thank you also for your stewardship of this committee in the prior cycle. I think that was really important as we, as you said, allocated significant funds, and also with that community process through the fall, I think it helped throw up a lot of good ideas. So thank you for your leadership on that.
Thank you, Madam Chair.
Councillor Louis-Jen.
Thank you, Madam Chair, and thank you to the administration. This is a very important hearing to talk about how we make use of these once-in-a-lifetime funds. We all know that the pandemic has disproportionately impacted low-income communities, communities of color, and immigrant communities. And we're going to hear what I think is really insightful and really pertinent testimony from different community groups, especially Black and Brown communities and immigrant communities. All residents and stakeholders must have a continued role in the process of determining how we dispose of these funds in a matter that, in a way that centers equity, that centers for correcting past policy harms. We are also talking about billions of dollars, over $1 billion in funding. And we need to make sure that there's a lot of very worthy and necessary causes that we can spend this money on. But one of the most important things that we can do as a city is, probably what is on the more boring side, which is investing in protecting our city against the next pandemic or the next surge, and making sure that our schools are prepared, our businesses are prepared, and that our government infrastructures are prepared to face the next crisis. So I'm interested in hearing about that and learning about where we stand there, and how we're going to protect ourselves and our most vulnerable communities. When we think about these big issues, the pandemic, war, global warming, how are we preparing for the unthinkable here as a city? So I'm grateful for this hearing, grateful for the administration for being here, and the wonderful testimony that I'm sure we're going to hear from members of the community. I won't be able to stay on for the entire thing, but my staff will definitely be on and taking diligent notes. So thank you.
Thank you so much, Councillor Lujan. Councillor Baker.
Thank you, Madam. Excuse me. Thank you, Madam Chair, first for filing this, and also to your co-sponsors, Braden and Morel. This is a good start. Also appreciate the deck put together by the administration and your budget team, Jim and Justin. So I'm happy we're here. I'm happy we're here doing this, and to kind of pick up on something that Councilor Flaherty was talking about, how we can maybe advocate for some of these dollars, actual dollars. I mean, I have projects close to my heart that I think would be investing generational, building infrastructure that would be a generational investment. The opportunities, and I'm talking about the field house over in Columbia Point there, the Boys and Girls Club. So hoping that you guys are going to be open to discussions and potentially helping the group from the Boys and Girls Club advocate for some of this money, if there is a way. They have a youth group together that has helped to plan the whole space. I mean, I just want people to be open or come to the hearing that we will be having on the field house specifically. So and remain open to it. Appreciate it. And Justin, good job in your stewardship of the budget over this past couple difficult years. Good job.
Thank you, Councillor Baker. Councillor Flynn, Council President Flynn.
Thank you, Councillor Bach, for the important work that you're doing, and for Councillor Braden and Councillor Worrell as well, and Councillor Flaherty, who's been very active and involved. We're receiving hundreds of millions of dollars of funding from the federal government, which provide us not only the funding to help our city, but also to make lasting investments in infrastructure, the environment, housing, transportation. So it's critical that we know where these dollars are going, how projects are funded, and what impact they have. I highlighted over the last several years, digital equity is important. Continue to invest in Wi-Fi infrastructure, so our low-income residents can access the internet, but also other projects as well. Affordable housing is critical. Myself and Councillor Flaherty did a lot of work on HVAC systems in the Boston Public School system. With all this federal funding, we have to make sure that our Boston Public Schools are in good shape. But I'm here to listen. I'm here to learn. I'm here to listen to my colleagues in the city administration. I want to thank Mayor Wu. And as Councillor Baker mentioned to Justin, he has done a very good job, very professional. So I want to acknowledge Justin, but also his team that he has in place, and Mayor Wu's leadership as well. And my councilors, our councilors, for their positive leadership. Thank you, Councillor Bach.
Thank you so much, Councillor Flynn. And I will echo the thanks to Chief Sterrett and his team. He's here today on behalf of the administration, our Chief Financial Officer, Collector Treasurer, and Chief of Administration and Finance. And then joined by Jim Williamson, the Director of the Office of Budget Management, Casey Brock-Wilson, the Director of Strategic Partnerships for the City of Boston, and Scott Finn, our Assistant City Auditor. So that'll be the team presenting. I do want to note that we also invited Nate Cooter, the CFO of Boston Public Schools, and I know that BPS has sent along information that's included in the slides, and I know that the administration intends to speak to that. I'll speak more further. I do feel that the Boston Public Schools needs to come and talk to the City Council about their federal COVID relief allocations, and so I do think that that's going to precipitate a follow-up on our end. But I'm grateful for the team that's here today and for the information that BPS did send along. So without further ado, I want to turn it over to Chief Sterrett. And as a few councilors have alluded to, we really asked for the team to give us a pretty comprehensive overview. So I think this presentation will be a little bit on the longer side, but in this case, it's something that the council very much asked for to make sure that we kind of had all the information out on the table. So Chief Starrett, you have the floor.
Thank you, Madam Chair and Council. Casey's going to put up a deck on the screen, but before we dive into the details, I want to thank the council for a really strong partnership over the last 2 years. I happened to go back and look and see what we were doing 2 years ago, and it was actually this weekend. We were in the throes of the beginning of COVID, and we were trying to figure out how to buy 5,000 laptops for kids to work on remote schooling. So we really have come a long way, and these resources that we're going to talk a bit about today have really helped stand up some amazing work over the last 2 years as we've fought COVID, whether it was remote learning or Boston Hope or all the different programs we stood up around food access, and these federal funds really helped pave the way for it. And it's really been a testament to the work across not only the administrations and the sort of folks in all the different departments who put these together, but the council as well, who have been fierce advocates along the way for making sure we have the right programs in place and really bringing the issues that may be at hand to the forefront so we can address them starting to use this funding. Counselor, you are correct. This is a long presentation, so I will do my best to really try to frame up where we've come, and then definitely sort of agree with the sentiment that this is not the end. This is really the beginning of the conversation around the rest of the federal funding that we have coming to us, and really look forward to bringing forward thoughtful proposals either as part of the budget this year or as part of future conversations in the coming months with the council. So really want to use this as an opportunity to sort of set the stage of where we've come and where we are to date, and then sort of some ideas and sort of some initial thinking on funding for the future. So Casey, could you go to the first slide? Great, thank you. So when we think about COVID, we think about recovery, we really have a bunch of different tools in our tool belt when it comes to resources that we have made available for this types of funding. Even before we knew anything about federal funding, we were running a very tight ship when it comes to the city of Boston, right? We have a lot of resources at hand and we put those to good use. So we really started this process of responding to COVID and responding to the recovery with the city's operating budget. And that's obviously something we do in partnership with the council every year. So really, core to everything we do is the $3 billion budget that we pass every year. In addition to that, we had a whole slate of different federal resources that came in at different times over the year. So I'm going to talk very high level about these different resources, but then the team is going to get through a very detailed analysis of sort of what we spent that money on to date and what's left to be spent. So FEMA reimbursements, as many of you know, FEMA is typically something we in Massachusetts use for major snowstorms when there's blizzards and there's a state of emergency declared. Really much more prevalent in other parts of the country, whether it's the South with tornadoes or hurricanes or the West with wildfires. We really don't use FEMA all that much for natural disasters. We really use it for snow. Leaving aside, COVID obviously became a natural and public health disaster that FEMA became available. So we sort of aggressively pursued FEMA reimbursements, both from the city perspective, as well as our partners with BPHC who had their own FEMA process. The first bill that was really passed as a part of the federal response and sort of the national response to COVID was the CARES Act. That included some initial funding for cities and towns, but also sort of some really targeted sort of public health, supporting hospitals, supporting our public health infrastructure. We'll talk a little bit about that. Coronavirus relief bill. This was the second somewhat smaller bill that was passed in December of 2020. This included some additional housing funding, ERPA, which we'll talk a little bit about. As well as some other resources to respond to COVID in public health and other areas, which again, we'll talk about. And then finally, the big one, which came last year, was the American Rescue Plan and had a couple of different buckets that we're going to spend a little bit of time talking about today. The local aid portion, or the SLFRF, which I know is a mouthful, is really the funding that comes directly to the city of Boston. And that's funding that we've used, as Councilor Flaherty mentioned, to fund both revenue replacement to support our day-to-day running of services, and we'll talk a little bit about that, as well as a slew of emergency, both COVID specific and then also recovery specific investments we've made over the past year with the council. So happy about that. That is also the biggest pot of unspent money, quote unquote, that we have sort of left available to program with the council going forward. The second bucket of money that came from the ARPA was the Esser funding. This is funding directly to the schools, and it's about $400 million, and we're going to talk a little bit about that. But again, certainly welcome additional conversations with the school district about that. The third bucket is around housing or sort of emergency rental relief. This is the city-specific funding. The state also gets specific ERAP funding as well that they've been using both throughout the Commonwealth, but also in the city of Boston. So definitely a resource that has been well utilized over the past year. And then the three at the bottom are really sort of things we're still working on, things we're still waiting on information for, things we're still advocating for. So the infrastructure investment obviously is more geared towards long-term recovery and long-term investments in our sort of physical infrastructure, our roads, our bridges, our highways, certainly our transportation and mobility infrastructure throughout the country. Here in Boston, I think we're certainly going after both what are sort of formula grants that we will potentially get, as well as sort of targeted competitive grants for different types of infrastructure projects that we are excited to continue to pursue with the feds as they start to release those in the coming months and years. The Massachusetts State Recovery Fund. So in addition to all of the funding that came to the city, the state also got its share of all of these different buckets that are on the screen. So we continue to advocate for both the local share as well as making sure that we can make our case known for sort of specific projects in Boston that might be relevant. And then finally, Build Back Better, which again, is still sort of up for discussion at the federal level, is probably a little bit less near term and sort of more of a longer term conversation, but definitely something we're going to keep our eye on, keep advocating for, and make sure that if and when it does pass, we will, certainly make sure we get Boston's fair share. Can you go to the next slide? Thank you. So all told, throughout all of those different buckets that I just mentioned, we have about $1.2 billion worth of federal support. Now, much of that has been spent to date responding to COVID, and we'll talk a little bit about what that means. There is still hundreds of millions of dollars available through both Esser dollars as well as the state SLFRF, the state and local fiscal recovery funds, which we'll talk about and we've allocated to date. But all told, you'll see here, and we're going to go through each of these individually. I think the story, though, is that we have really done a few things, and I think really thanks to the council's partnership on this, is we've moved quickly on all of these different buckets of money. We have not sort of sat back and sort of waited for, delays for implementing this funding. We've really moved quickly to try to work with the council to get it allocated out and into the community and into the programs as soon as possible. And we really look forward to bringing a robust proposal to get the remaining funding. The remaining funding runs until about 2025, so we have a couple years to spend it, but it's definitely something that we want to start planning for now so that we can both be responsible with it, as well as make sure that we're getting the programs ramped up and ramped down in time. So I'm going to stop there, and I'm going to turn it over to Jim Williamson, who's going to start to walk us through some of the initial allocations. Jim?
Hey, Jim, you're on mute.
Sorry about that. Thanks, Justin. So Casey, we'll start with the CRF. We could probably start on slide 5. So just a quick recap in context before we start. In March 2020, the emergency public health declaration was put in place. There were stay-at-home orders being issued by governors. We also sort of went through that. And quickly on the heels of this, the CARES legislation passed in April 2020, and the program was set up to quickly infuse communities to provide a robust response, not hindered by state and local budgets and cash availability. So here's a summary of Boston's $121 million CARES CRF grant, some bulleted general requirements, and the overall allocation implemented here at the City of Boston, listed in high-level spending categories, including city expenses at $23.3 million or 19%, public health 31.5 or 26%, Boston Public Schools 23.2 or 19%, economic development 24.2 or 20%, housing and homelessness 18.5 or 16%. We can move into the next slide. This slide is a bulleted list of the various city expenses that we use CRF funding for. Personal protective gear for public safety and city staff, food delivery and services for vulnerable residents, personnel and staff responding to COVID-19, cleaning and disinfection of public areas and city facilities, technical assistance on mitigation of COVID-19 related threats, technology to enable telework capabilities for public employees, and other public health and medical expenditures. Next slide. So I think the slide before that is. So here are a slide for some of the bulleted public health measures. So some of the big things, these were primarily rolled out by the Public Health Commission. So testing and contract tracing, vaccine staffing and distribution, disease containment, quarantine and isolation, communication and community engagement, public health workforce support, and system resource and management availability. So, so these are some of the schools, the CRF funding, in addition to the Esser funds that went directly to schools. So I think Justin talked about sort of that emergency procurement to get Chromebooks, to immediately get to students to promote remote learning, software and curriculum to support remote learning. Then there were summer sessions paid for to target any learning losses. There was facility improvements to promote public health, additional PPE and air purification and circulation equipment that was procured as schools were reopened. So this slide covers the economic support that was provided through the CARES CRF funding. There was lots of small business relief, grants to small businesses. The Reopen Fund helped businesses buy PPE, safety equipment, procure outdoor seating. There was a whole commercial rent relief component that was targeted hard hit industries, restaurants, other industries, focused in neighborhood business centers. There's a whole grant program structured around certified business to get resources to minority and women-owned businesses and other certified businesses. There was a whole program set up through the Arts and Culture Cabinet to get grants to artists struggling in the pandemic. And then just sort of a high level, we knew that the tourism and the restaurant sectors were really adversely impacted by, travel bans and all kinds of stay-at-home orders and restrictions. So the all-inclusive Boston campaign was developed to roll out and get encourage folks to come back, local participation, use of businesses, restaurants, hotels. You can move on to the next one. So this is the slide covers the CARES CRF for housing and homelessness. So this was this is before the emergency rental assistance program rolled out. So we were working out to try to make sure that folks could cover their rent, people who are unemployed. There was emergency shelters set up for supportive housing for homeless women and creation of a stable housing for people experiencing homelessness. And but it's something we want to really focus on here, because housing looks like it might be a smaller percentage in the allocation, but you have to recognize that DMD had this extra additional emergency rental assistance flowing through their program. So now we can move on to FEMA. FEMA is actually one of the earliest spending that, as soon as the federal government rolled out its emergency declaration, you could start advancing, some dollars available in the operating budget. But in here on the left side of this slide is the chronology of some of the things that happened through the FEMA process. There was the National Emergency Declaration. The administration came to the City Council for an accept and expend order for what was, estimated at the time at $10 million to support FEMA expenses. The whole program went through a restructuring where it moved from, historically, FEMA was always set up to reimburse you on a 75% cost basis. They changed that to 100% and then made it retroactive back to January 2020. In November, they extended the 100% reimbursement to April. Just this past December, we went and, because we continue to accumulate FEMA eligible expenses, we went for an additional accept and expend order that you guys gratefully you guys approved for us. And just recently, in the last day or so, we found out that the federal government has extended the 100% reimbursement period from April to July. So we're trying to wind down some of the projects that we're having, but there, you know, any opportunity that we can to maximize FEMA, we intend to do that. Go to the next slide. So I think we covered this during the hearing for the $6 million accept and expend order, but it's been updated a little bit. The city of Boston's doing really fantastic in terms of actually pulling in the revenue from FEMA. We have $10.6 million that have come through the door already. You know, almost $6 million for emergency feeding, run through the A-Strong Commission and the Office of Food Justice. There was the city collaborated with the state for $2.3 million for the BCEC, the Hope Hospital, Emergency Hospital for homeless patients. There was $1.1 million for emergency sheltering, $1 million for consulting to organize all of these responses. And then there was additional information, communications out for different programs and how to manage through public health response. And we're still working through the program. There's lots of documentation required for FEMA reimbursement process, but we're going to continue to pursue reimbursements for personal protective equipment, cleaning, sheltering, administration, and so this does not include the Public Health Commission has a substantial amount of claiming. I think it's in the $20 to $30 million worth of claiming. So it is a public health emergency after all. So that's where you would expect the bulk of the emergency response to be centered. But you know, obviously the city has stood in their place. With that, I will turn it over to Scott, who will cover the beginnings of the American Rescue Plan, or the ERAP, sorry.
Thank you, Jim. Good morning, councilors. So the city received two awards under what is called the Emergency Rental Assistance Program. The first award, which came in December of 2020, the city received $21 million. And then under the American Rescue Plan in March of 2021, the city received an additional $30.1 million for emergency rental assistance. In April of 2020, the city created the Boston Rental Relief Fund. This fund was created to support low and moderate income residents who have been negatively impacted by the pandemic. We allocated $58 million of federal funding to be committed to this fund. $8 million originally came from the Coronavirus Relief Fund, and then the additional $50 million from the Emergency Rental Assistance Program. As of January 2022, the city has distributed $30.1 million to over 4,000 households in the city of Boston. The ERA funding is also used for community partner grants, and these are grants that are to local nonprofits that help us promote the rental relief fund, as well as to provide assistance in the application process for residents. Under this fund, the eligible uses are to serve households earning less than 80% of median income, and they can apply up to $17,000 in financial assistance, which covers rental arrears, future rents, and move-in costs. And they are also eligible to apply up to $2,000 for utility arrears as well. So this slide breaks down certain metrics on how the funds have been distributed. These metrics, just to note, are required by the federal guidance under this program, and we are required to report these metrics on a quarterly basis to the federal government. We also have a breakdown of the languages spoken by individuals who have applied for this fund, and that it's important to note that the applications under this fund are available in 11 different languages. I think this slide covers 9. There are 2 additional languages that the applications cover as well. In the last slide is also a federal requirement. We are also required to break down the emergency rental assistance distribution by neighborhood on a quarterly basis as well as the federal government. And this is where our breakdown is as of January of 2022.
Okay, great. Thank you, Scott.
You're welcome.
So I'm going to briefly touch on the Esser Funds or schools funds that Councillor Brock mentioned at the beginning of the conversation here today. As you'll notice, there's 3 different Esser awards that have been made across 3 separate federal bills. These total to about $430 million to support our BPS students and our schools in recovering from the pandemic and also providing making in-school learning safe and healthy for our students. So I will talk at a high level today about each of those 3 buckets of funds. And the first one, Esser 1, which came in the first bill, along with the City of Boston contributed an additional $23 million from funds that we received directly at the beginning of the pandemic to really bolster the school's response for a total of about $55 million that was available to our schools, kind of thinking back to the beginning of the pandemic. This was primarily spent on supporting our students and also returning to safe in-person learning, as I mentioned before. At a high level, you can see some of the buckets of spend that Esser 1 funding was used on. It is about $25 million for health and safety, $9 million for food and nutrition services, $10 million for expanded summer learning and academic supports, $5 million for the special education assessments and compensatory services, as well as $5 million for distance learning technology and $1 million for family student engagement and support. And the other thing, as the additional bills were passed and Esser 2 and Esser 3 became available, BPS kicked off a community engagement process last spring to inform the future spending. And so some of the stats about that community engagement are shown here on the page. But one of the most important things that I think we heard through that process is that the stakeholders wanted a mix of both district-wide initiatives as well as school-specific initiatives that allowed schools and their leaders who knew their students well to design supports for the recovery of their own school communities. And so that is reflected as we think about the Esser 2 and Esser 3 strategy that BPS is deploying, of which about $161 million are those school-directed funds, which are aligned to the school improvement plans and informed by the school community, parents, teachers, and so on. There's an additional $207 million for district-wide investments that I'll dive into in the next couple of slides, as well as $3 million for additional COVID costs and $18 million for community partnerships and cross-school innovation. So across Esser 2 and 3, it's about $399 million. So as we dive into the district-wide investments, again, at a high level, there's a lot of stuff in here and a lot of information behind each of these bullets, but I will just talk at a high level today on some of the big investments that we're seeing. Number one, of course, is strengthening our core instruction. BPS is expects to spend about $43 million to accelerate ongoing efforts around literacy instruction for all students in our schools. And they're also spending an additional $17 million to ensure inclusion and quality supports for students with disabilities, another $19 million for multilingual learning. In addition, there's an additional $16 million for high quality pathways around career planning and academic counseling, as well as $23 million for equitable access and opportunity for arts, athletics, and out of school enrichment. $33 million to engage our communities and our families and redesigning how we think about social, emotional, and mental health supports, and $55 million to just improve our school environments to make really unprecedented investments in clean air, water, and addressing COVID health and safety concerns, but also long-term improvements that we know we need to see in our school buildings. Great. So I will now turn to talking about the SLFRF funds, our favorite terminology. As you'll see here, this award to the city totals about $558 million. And what's important to note is that the city received $424 million directly from the federal government to the city. And then the remainder of that we received from the federal government through Suffolk County. Suffolk County received its own allocation, and that allocation was then split on a per capita basis across all of the cities that are in Suffolk County. So that gets us to that $558 million number that we're looking at here. This is often what colloquially we talk about as ARPA funds, but really the technical term is SLFRF. As we think about kind of how the federal government has defined the eligible uses of ARPA funds, there still is a tie, obviously, to the COVID pandemic and ensuring that we're supporting public health response in addressing the negative economic impacts of COVID that we are all kind of so aware of and mindful of. I think one of the exciting things for this administration is that the federal government also included an eligible use around equity-focused services. So that allows for additional flexibility in our hardest hit communities to address health disparities, invest in housing, think about educational disparities, and promote healthy childhood environments. So this is kind of broadly applicable to qualified census tracts, which I'll dive into on a later slide. The three sections on the bottom are our public sector revenue loss, which Jim will talk about in a few slides. And then there are also two infrastructure categories, both broadband and water and sewer infrastructure. For the most part, those are hard infrastructure investments and digital literacy efforts and education focused efforts around digital equity actually fall into the address negative economic impacts category. One of the things that's been kind of tricky for us to manage is that even though the bill passed in last year in March, the final rule for how the funds could be spent was actually not released by the federal government until January of 2022. And that provided some pretty significant updates to the use of the SLFRF funds. Specifically around some of the infrastructure categories as well as capital expenditures. So for example, on the capital expenditures side, they specifically name the types of capital expenditures that are allowable and ones that are not allowed that you can see here on the page today. And even as of this week, the federal government has changed all of the expenditure categories that define the spending. They've added some, they've taken some away. So the other piece, of course, is just managing the ongoing changes at the federal level to ensure that Boston is in compliance with these funds and maximizing the potential eligible uses. The other piece that was defined more clearly in the final rule is more about how the federal government defines impacted and disproportionately impacted communities by the pandemic. And so the table on the left here both defines those households and families, and then also explains the eligible activities for both groups. Disproportionately impacted households are eligible for all activities listed on this table, but not vice versa. So there are additional opportunities to support disproportionately impacted households in things like housing vouchers, housing investments, investments in schools and their students, as well as on the small business side, physical rehabilitation of commercial properties and technical and financial assistance. The map on the left just shows what the federal definition is of a qualified census tract, because that is such an important way that the federal government defines disproportionately impacted communities. I just wanted to share that map with you all here today. The other piece that continues to, we have to be nimble and adjust to, and really want to thank Scott and the auditing team for their lead on this, is how we report on these funds. So At a high level, there are kind of our quarterly deadlines that the city has to meet, as well as an annual deadline. So we submit an annual recovery plan every year, and then project and expenditure reports each quarter. We just submitted a project and expenditure report on January 31st, and our next project and expenditure report will be due on April 30th of this year. In addition, one important thing to note is the timing of these funds was confirmed in the final rule, which says that the recipients must obligate all funds or contractually that they are in contract by the end of 2024, and then they must be fully expended, all invoices must be paid, et cetera, by the end of 2026. Okay, so that was a lot of the nitty gritty on these funds. I'm just going to hand it back to Justin to talk about at a high level where we are today on SLFRF funds.
Thanks, Casey. And before I jump into that, I do want to, give a special thanks. It is unbelievably complicated, the evolution of federal fundings, not to mention standing up new programs. So the staffs across all city departments who have been working diligently to get these dollars out the door as quick as possible, while also maintaining the integrity of the data and integrity of the programs, it's just been nothing short of a miracle. I mean, it takes forever to sort of do anything in government. And the fact that we've been able to not only stand up all of these new programs, but do so in a way that keeps us on the right side of compliance with the federal government is a real testament to, I think, both the departments and then obviously Scott, Casey, and Jim and their teams as they roll out what is a very complicated process and evolving, as Casey alluded to. We're getting new information almost weekly at this point. So I'd want to give a special shout out to them. As Councilor Flaherty mentioned, of the SLRF dollars that we have received, we have already started the process in consultation and in collaboration with the council of allocating that funding, right? So I'm going to talk very high level about what we've done to date or what we've committed to or reserved for date. So last July, we passed with the council an emergency relief package around some specific, both COVID related work that needed to continue last summer, as well as some initial recovery efforts that we'll talk about in a little bit, as well as the revenue replacement portions, which Jim will talk about in a second, but basically help offset some of the sort of hundreds of millions of dollars in city dollars that we have lost because of COVID as part of the general fund. This sort of small allocation helps us maintain the frontline services that we need to provide, whether it's in our schools, our public safety, our public works, all of the important programs that we have and we care about and we sort of partner with the council on is supported by this revenue replacement. So while it comes across as sort of like what exactly is this goes for, this actually goes to pay for all the important programs that we run on a day-to-day basis. So I'm gonna let Jim get in a little bit more detail about those specifically, but the $350 million you see on the right there is the world of money that we have left that we need to partner with the council on to pass as part of upcoming potential appropriations. Now, we will certainly hear from obviously the council and many in the advocacy community about how to spend some of this. We have certainly heard loud and clear that housing continues to be a major priority of this funding, as well as continued COVID recovery and other areas. So definitely look forward to not only the council's feedback on how to propose this funding, but also the community and the public at large. So if you could flip to the next slide, Jim's going to talk a little bit about revenue replacement and why it's so important.
Thanks, Justin. So here's a visual that shows the very material impact the pandemic has had on the city's revenue sources. So that the justification for revenue replacement is based on a counterfactual formula provided by the U.S. Treasury. So the concept of ARPA revenue replacement in a nutshell is that not only can you prove the revenue loss in real dollars from pre-pandemic levels, you can also attribute the loss to anticipated growth factor that you experienced in the years preceding the pandemic. So this graphic sort of shows that need for the revenue to be replaced. There was $210 million in loss here. So we've already, through the help of the City Council, appropriated $55 million just to keep the FY22 budget in place to not only just maintain core city services, but also to do those targeted operational investments to help recover effectively from this pandemic. Go to the next slide. Thank you. So this slide shows how several cities have used their FRF funding. As you can see, some of the larger cities at the top have exclusively used their state and local fiscal recovery funds to cover revenue replacements. Boston is in a little different position in where we're looking to just modestly reserve about 20% of the ARPA dollars for revenue replacement. The rest will be made available for the continued emergency response and longer term impactful projects. Now I will turn it over to—
Hey, Jim, before you jump on, I just want to add a little bit of context here. So these cities that are on the screens obviously all have their own differing tax bases of what they spend on. The vast majority of them all rely on is at least 50% property taxes. So while Boston is sort of an outlier in its use of this funding, we're actually pretty consistent with many of these communities and how they fund their government. I would also say many of these governments are using this SLRF funding to replace the services that they cut during the height of the pandemic. Boston was fortunate. We didn't do any layoffs. We didn't do any service cuts. We tightened our belt. We found savings in different ways. But we don't have to be in the same position as them as using this funding to really just try to get back to where we were pre-pandemic. We're using this funding to sort of, as Jim mentioned, make some targeted investments and really support our workforce, who has been really working on the front line over the last couple of years. And it's going to be really important that this goes forward. And we're really proud that we're only able to use about 20% of this as part of the city budget, and the rest can really go, as Jim mentioned, towards those targeted community-based investments. Sorry, go ahead, Scott or Casey.
Great. Great. So I want to turn here and dive deeper on a slice that Justin talked about earlier, which is the emergency relief package that was passed last July that the council was such a key partner on getting passed and helping us decide how to use those funds. And so as you kind of think about that holistic emergency relief package focused on community-based programs, the chart on the right shows you kind of how those funds were designated by department. As you might expect, the departments that received the majority of the funds were housing, economic opportunity and inclusion, the health commission, transportation, among others, to really support this effort. Obviously, we know food access, for example, is has been an incredibly important issue throughout the pandemic. That slice, I think some might say would think is smaller than than expected. But I think that's why it's important to look at the whole picture, because we know FEMA was a really important tool for our emergency feeding program. So again, we're trying to make sure we're maximizing resources that we can across all of these issue areas. On the left-hand side, you'll see some of the recent programs that have been launched using these ARPA funds. So the fare-free bus pilot expansion, which was passed in partnership with the council in November. The Green Jobs Program, Small Business Fund 2.0, which I know Director Urtubey spoke about with the council in January, as well as some other really important programs that I think I just want to take some time to highlight that are led by our incredible departments. We've prioritized creating language access for all of our federal funding and put a specific allocation forward there to support language access around all of our programs. There's a commercial rental relief fund. We've done grocery distribution, basic needs for Boston households not eligible for federal benefits to support our undocumented community here in Boston, as well as emergency foreclosure prevention funds. So there's so much detail behind every single one of these programs, as Justin mentioned, led by our incredible departments. And we can't dive in on all of them today, but just know that there's a wealth of kind of detail and information behind this, behind each of these programs, and effort by a lot of folks in the community and in our departments. The other piece is that this administration has been really committed to is trying to provide as many ways as possible to share information about our ARPA funding, because we know so many folks are interested in it. And so if you go to boston.gov/recover, there's an incredible wealth of resources there. We are ensuring that we are posting not only our annual recovery plan and our quarterly compliance reports that we report to the feds, we also have a dashboard that Councillor Flaherty mentioned at the beginning. And I want to thank our Do It team for pulling this together. And this really is a way for us for folks who want to dive into the details, they can click into each of these colored squares. The project name pops up. There's information about the project, the website, the contact information for someone who's interested in reaching out to learn more about those projects. There's also a table that shows open opportunities for funding across all of our different departments that small businesses, nonprofits, arts organizations can apply for. The other piece that is a recent addition to our website is more about the Let's Go Better listening campaign that Councillor Flaherty also mentioned at the beginning. And we really wanted to come back to both the council and the broader Boston community and share more about what we heard from Boston residents about the ARPA federal funds. And so there were about 15 community meetings that were held in September and October of last year, focused on a variety of different challenges that Boston faces that we're seeing here today, that you're seeing on the slide in front of you, from home ownership to stronger career pathways, affordability in childcare, food insecurity. We really wanted to cover kind of a breadth of topics and hear from community members in each of these areas. And so overall, there were about 581 meeting participants across these 15 meetings and an additional 500 survey responses specifically around these ARPA funds. And so again, this is just a high level overview, but I would love to direct folks to the website where we have posted this Let's Go Better listening campaign report. The 35-page report details the major themes that we heard, the gaps that we heard from residents that they'd like us to invest in, as well as potential solutions as well. It also contains a lot of information about both the demographic and neighborhood distribution of attendees and survey respondents as well, as the survey was available in 11 languages. And I just wanted to share one quick kind of snapshot from the report, which at a high level, we asked folks to prioritize areas for recovery. And Justin alluded to this earlier, but across so many of our avenues, the number one thing that we are hearing from our residents is that housing stability, home ownership, affordability are all was really the number one priority as you look across these different categories on the page here today. And I'm going to pass it to Jim quickly to talk about the budget listening tour, which is in partnership with the City Council.
Thanks, Casey. So I don't need to spend too much time on this slide since we work so closely with the City Council on this, but the FY23 budget listening tour was conceived with the goal of going straight to the people, working collaboratively with the City Council to hear residents' thoughts and ideas. We just finished the listening tour, but we will keep our survey open throughout the budget process, and we want to continue to work in collaboration with the City Council to be the most impactful budget that we can create. So with that, I will just turn it over to Justin to close.
And I promise this is the last slide. And this is really, we want to turn it over to the council, one, to have a dialogue and the public to have a dialogue. But just some framing about how we think about the remaining $349 million. I think Councilor Louis-Jean said this, jump-starting solutions to some of our long-term challenges that existed before COVID, right? Systemic racism, systemic disinvestment in certain communities. I think we are certainly focused on that as something. We want to come back better from COVID. We don't want to go back to where we were before. We want to really, move the city forward. Cross-functional investments. How do we invest $1 and have it impact a whole bunch of different areas is super important to us. And that's really what we think is a sort of a comprehensive and best practice way of, making sure these dollars can be most impactful. We want to make some big bets, right? We want to sort of put this type of sort of transformational level of dollars into the types of investments that sort of are not available to the city on an annual basis, right? We're talking about, potentially hundreds of millions of dollars. How do we put that to use in this sort of unique circumstances where we don't typically talk in that level of investment in certain areas? And then we certainly want to think about financial stability. Anybody that was around for the recovery in 2009 to 2011 heard about era cliffs, right? Basically creating programs or funding services that went away after a while, and after the federal funding went away, and it created some real budget challenges for both localities and states as they were trying to deal with the sort of the funding not continuing after the program. So I think both from a programmatic perspective as well as a city perspective, I think we're really focused on that. And then finally, as Jim and others mentioned, incorporating feedback from both residents directly, the budget listening tour, the council process, council public process that we'll do. We as I think Councilor Brock mentioned, this is not a hearing on a specific appropriation order. We will be back in front of the council with those types of orders in the coming months and year to sort of bring this to a place where we work closely and we ultimately vote, or you ultimately vote on it, and we move forward in partnership. So we're excited. Really happy to take any questions on what I know was a long presentation, but covered a lot of different programs and a lot of different priorities over the last 2 years. And again, I just want to thank the council, thank previous administrations, thank this administration for what has really been a good process over the last 2 years of both being good stewards of this money, but also investing really intently and practically in some of the hardest hit areas and hardest hit communities with this federal funding. So I'll stop there and turn it back over to the council.
Thank you so much, Justin and team, for the very thorough presentation. We'll go now to councillor questions. I'll reserve mine for the end. So I'll go first to my co-sponsor, Councillor Liz Braden, and then it'll be Councillor Worrell, also a co-sponsor, Councillor Flaherty, Councillor Baker, and then Councillor Tanya Fernandez-Anderson of District 7, who's also joined us. Councillor Braden, you have the floor.
Thank you very much for an incredibly thorough and detailed presentation. Thank you for all your work. I think the City of Boston has done an incredible job stewarding these funds that have come into our city over the last few years to help us weather this COVID storm. There's a tremendous, I do share your concern about the drop off, if we fund projects or programs in the short term, and then the money, once the money's spent, then there's this fall off. So I think it's really important to be very diligent. The one question that I have, and the one sector that we have in our city that has been an incredible resource for our neighborhoods during COVID is the small nonprofit sector. And I don't know if there's any space or scope within all of the way things are targeted to help those small nonprofit sectors recover from the impact of COVID. I'm not really talking about the big institutions, the big nonprofits. I'm talking about the smaller institutions that are very much neighborhood based, that maybe have been a lifeline for our communities over the past 2 years. But now that the things are settling down and they're looking at the impacts and the costs of all of they've been putting out, and in terms of extra staff or resources that they have expended, is there any possibility of looking at some support for our small nonprofit sector?
I'll take a shot at that, and then Casey, feel free to jump in. I think immediately what jumps to mind is two opportunities. One, on the school front, obviously, anything that's education focused or youth focused, they obviously have a lot of partnerships already with existing programs, and I think it's pretty clear within their allocation of what they intend to use it on. They want to encourage that and really promote that type of community-based partnership. So I would certainly look there. As far as it relates to the sort of the ARPA dollars or the city dollars, I think absolutely opportunities to invest. The only thing we want to be mindful of, it has to fall into one of those COVID-specific buckets that we mentioned, that Casey mentioned around how the money can be allocated. So we just want to structure a program that reflects that need. Casey, anything you want to add there?
Great. Yeah, I think there's a couple programs within the ARPA allocation that's hopefully specifically focus on this. And like Justin said, there's room for growth. One is a social determinants of health community grant program that's led by our health commission that's specifically focused on community-based nonprofits on the smaller side. And then our Office of Food Justice has done an incredible job putting out around $3 million in grants around equity in food access, as well as a kind of a community solutions grant where that was very open-ended and went out to our nonprofit partners and even individuals to say how, there are ideas within your community about how to solve food access and food insecurity issues. And it really listened and responded to what those small nonprofits and individuals put forward. So there are opportunities, and I'm sure I'm missing a couple because there's so many different programs, but wanted to highlight those two in particular. And then I think, of course, there are opportunities going forward as well to support community nonprofits, which are such an important backbone for our residents.
Thank you. Madam Chair, that's all I have for now. I have some other questions, but I'm just trying to find them on my computer. I'll swing back later. Thank you.
All right, sounds good. Thank you so much, Councillor Braden. Councillor Worrell?
Thank you, Madam Chair. Thank you to the administration for the very informative presentation that you presented. Just for clarification for me regarding the SLFRF dollars, we have 558 million left. Of that 558 million, we have 209 designated, right? And then 115 million is going to be given towards revenue loss. Is that correct?
So maybe it's helpful. I'll just do high level. So 558 is the total we got from SLRF.
Yeah.
We have either reserved or actually appropriated about 115 for revenue replacement. That includes 55 million that the council has actually appropriated, and then a drawdown over the next 2 or 3 years of the remaining 60 or so million, which, as I mentioned before, is super important to maintaining the city's financial health. And then of that remaining amount, we've allocated about 80 of that left. So you go 558 minus 115, that puts you at about 440. We've put another 80 into what Casey talked about earlier about that emergency relief package. So that gets you down to about 360. And then we did fare-free buses back in November, which is another 8. So that puts you at about 350 in remaining sort of unreserved, unappropriated dollars. Now, there has been a lot of conversation about how to spend that money, housing, other areas that we've talked about. So there's definitely ideas around there, but that's exactly what we have left to appropriate.
Okay. All right. And then in terms of the listening sessions were great. Is there any opportunities to have, more listening sessions? I feel that, not a lot of my civic leaders or civic members were at that last listening session that we had. Is there more opportunities with the administration to have listening sessions within the district?
I won't speak for President Flynn or I see Councillor Anderson Fernandez on here, but I think we'd certainly be open to exploring it over the next couple months. We do want to be mindful that the council will be kicking off their own, hearing process in the coming 6 weeks around the city budget. So we want to make sure we can, be mindful of that process as well.
All right, no further questions. Thank you.
Great, thank you so much, Councillor Worrell. Councillor Flaherty?
Thank you, Madam Chair. Justin, and thank you, Justin, and your team for the presentation. Very thorough. Just a question, I guess, as looking at the balance, I guess, of the funds, is that GBIO and a network of affordable housing organizations all sort of banded together to secure commitments from the administration and members of the city council, particularly in the last municipal election, along with follow-up meetings after that. So I guess just to put it right out there, how are we handling that, and how much money has been promised to GBIO, and what's the balance, and how are we going to work through that? Because we only have so much money. We're going to get pulled in 1,000 different directions. But there are members of this body. There's also the administration have made commitments. They gave their word. They pledged. They signed a packet or questionnaires that went out. So how are we squaring up with that, and how much money is available to honor those asks, and what will be left from that to distribute across to other worthwhile organizations. I want to put it right out there because there's no duck in this one.
Absolutely, Councillor. So I'll talk about what's available. So as I just mentioned, there's about 350 million sort of left that has not been appropriated or sort of reserved as a part of this process. As you alluded to, certainly I think the mayor, again, and the council, I think we share the goal of funding those commitments. So I think if and when we do file orders to reflect those commitments, it'll likely come out of that 350 million that's remaining. We obviously have not done so yet. I think we're still working on, as we sort of think about the budget, we think about sustainability, we think about the best uses of resources. I think that all goes together as one package. And I think that's where we'll hammer out exactly how much of that remaining 350 will go towards housing. I also think not only is it, what maybe has been committed to, it's also reflective of what the community through the various processes we had, whether it was the fall process or even our most recent budget listening sessions, have all been primarily housing focused or have been heavily housing affordability focused. So I think it's not only a sort of a reflection of commitments, but also the need that has been demonstrated by the community and what we're hearing. So I think that is the sort of the world we're working in, Councillor, and of that 350 that's remaining, that's where any future commitments would come from.
And if you could keep us updated as to what commitments have been made, and specifically of those commitments, as GBIO, if their request has been satisfied, there's obviously a lesson here. Obviously, when you make a commitment, you want to follow through on it, but at the same time, need to make sure that you're not committing everything to everybody, because there's just not the fund's just not there to commit everything to everybody. So I think there's a lesson in all of this but as you're going forward, so that folks who did make those commitments to those various organizations, so that they're honoring those commitments, if we can be kept abreast as to what percentage or what amount of funds have been dedicated or earmarked to that specific request, helps us obviously be able to manage, what's left to spread around, I guess, to other groups and organizations in needs of our city.
Councillor Flaherty, are you all set?
Yes, thank you, Madam Chair.
Thank you so much. And I'll just underscore, because I know we've got some members of the public waiting patiently to testify, that of course, like that's also what this hearing is for, is to create space for folks to amplify both, asks that were made on the campaign trail over the past year, and also just other things bubbling up in the community. I did just want to clarify for anybody watching the reference that Councillor Flaherty was making was to the Greater Boston Interfaith Organization, which hosted a series of forums and did have asks for city councilors and mayoral candidates related to the ARPA funds. Those asks were not about funds to go to GBIO as an organization. They were about commitments on particular areas of investment, as Chief Stewart has noted, mainly housing related, both home ownership and rental housing, and also public housing. So I just wanted to stress for anybody watching at home that I think those processes, which, as Justin said, were political, but kind of parallel to the community conversations that the administration was also holding, were kind of more about areas of investment rather than about particular organizations looking for funds. And I'm sure, again, I won't go further into depth with that, because I know that we've got a number of community advocates who are patiently waiting their turn to speak on their own behalf here. So, all right, next up is Councillor Baker.
Thank you, Madam Chair, and thank you everybody for your presentation here today. So there's 350 in SLFRF, and then also SE. How much is available in SE?
in the Esser dollars. So Casey, I don't know if you have that number offhand, but the city got, or the school committee got 3 chunks of it. The first chunk has really been spent. That was sort of from getting kids back to school. The second 2 chunks have gone through their own community process, and it's about, sorry, pulling it up. It's about 399 million. Now, some of that is being spent right now, and some of that will be spent in future fiscal years. Casey, do you have when that funding needs to be spent by? Do you remember?
It depends on the tranche of funding. So ESSER 2 and ESSER 3 have different deadlines. We can get back to you with exact spending figures on it.
And so the school money is just going through a school process. City council has no say on that at all.
So the funding is awarded from the state to the school district. We obviously worked in concert with them as part of their overall funding for next year, whether it's their operating budget, capital plan. Federal funding does play a part in that conversation. But technically speaking, yes, the school committee votes on the award and they accept the allocation of it on their own.
Yeah. So I was, because I'm trying to figure out what the best space, or again, ask you guys what the best space for the field house will be. Like how should I identify what I'm asking for? Is it coming out of SE through the school because the field house will be attached to the school, or is it coming out of SLF-RF money, or do I drop it all together? It's, I have an ask in for 10 million. I don't know. I'm looking for the slide here, but there was a space that said for capital, you couldn't build congregate spaces. Did I have that language right? I don't have the slide in front of me here. I'd have to look for it. Under the capital slide, Casey.
Yeah, there's some pretty specific capital expenditures language in the final rule. I'd have to dig in deeper on the specific project you're talking about. Just internally, as we've been thinking about, right, any capital expense, we're reviewing them on a one-by-one basis because the language is so complicated.
Yeah.
I've probably read it 50 times myself. But yeah, there are some very specific restrictions around capital expenditures that the Biden administration wrote into the bill for SLF-RF funds.
Well, because if there's some intersectionality there if you're looking to build spaces that will improve family lives and improve, overall health, where, if you can't build larger spaces like a community center, so say, then it seems like they conflict with each other. So I'm wondering if there'd be any way that we could reach out to our delegations to be able to soften that language, to be to allow us to go after a capital plan that can be built in. If we make a commitment that there's the governor in a supplemental budget filed some language that I think will make a matching grant available. So I'm looking to match on to a state commitment for upwards of $10 million from the state, and maybe we can work on something like that. It's newly filed legislation. Casey, I'll try and dig it up and get it over to you and see if there's a way we as the city can make a commitment towards a building that will, for generations, help kids, families, adults be able to improve their standard of living. So
I'm happy to look more into it because it is an area that's very complex in the legislation.
But also it lands in the area that's an opportunity zone. That's an identified census tract. There's a lot of reasons to point why we should be looking at a program like this and building a program like this while we have this money available. Because my fear is, for being around for as long as I have and gone through different economies, that in a couple years we'll be looking back and if we haven't built actual infrastructure for us to make our lives better, and this building is going to make lives better. So we're having a hearing on it. Casey, you will be invited, so we can tell the story then But I think the schools also should be at the table here and be looking at this building in a serious way and making a commitment into it also. Thank you. I've rambled on a lot enough. Thank you, everybody. Sorry, Madam Chair, I went on a little bit there.
No, thank you, Councillor Baker. And yes, we are definitely going to have that hearing on that docket. So we'll have opportunity for further conversation about that. And I agree with you that I think it's the same as for members of the public who are vocalizing things that they'd like to see funded. I do think that, it's our role as councillors and the role of members of the public to sort of articulate these needs that we see. And then I think the question of matching what funds are available to the right thing based on eligibility is something that we should be working in partnership with the administration on. And as I'll say in a minute, I think strongly that the schools piece needs to be in the conversation. But first I want to go to Councillor Tanya Fernandez-Anderson, District 7, and also the chair of our Ways and Means Committee, which is closely connected to this work. So Councillor Anderson.
Thank you, Madam Chair and co-sponsor Braden. Thank you so much for this. Justin, Casey, Chief Sterrett, my bad. And Scott, everyone here, thank you so much. Great job. I really appreciated the presentation and wonder if we can have a breakdown, some sort of a presentation, like just Barney style, 1, 2, 3, like real stuff that I could explain to my kids at home. Can we get something like that? Especially in the interest of, just teaching kids or bringing curriculums into school, financial literacy curriculums into school. I think that it's very important that we include our youth, but it would be great too for my grandma at home. Like, we want to understand, the community wants to understand exactly what's going on. The other part that I think everyone here kind of touched on, so I'll be brief. The part with Let's Go Better, and as well as the budget hearing sessions. Yes, we'll be doing some our own or district and citywide more budget listening sessions, break down what you guys have done already, and hopefully bring more more engagement. But we saw that we looked at the survey and it really did not touch, I would say fairly touch Black and Brown communities. The survey really seemed like it was lopsided. So if we can talk about how, or at least plan to engage more of the larger community, Boston being a minority city, that it was your survey that came back showed that I think the majority was of Caucasian population, and it did not speak to the priorities that you showed today in your presentation. And so I'd be interested in talking about that as well, and what's the plan so that we can reach people.
Yeah, happy to. One, we're going to keep the survey open, so we can certainly try to push that in partnership with you all wherever we're missing it, because we certainly want it to be reflective. And then I do want to say though, and I think we touched on some of the numbers. I know Scott talked a little bit about the ERAP dollars, which are the rental relief dollars, and that was a very heavily skewed towards our Black and Brown residents in Boston. So, I think while the response to the forum, we can certainly always improve, I do actually think many of the dollars are flowing to those hardest hit communities. One, by purpose, right? We're really working on that. But then also, as Casey mentioned, some of them have to only be spent in those communities. So I think it's both a active approach as well as the rules of the road from the feds actually dictate that's where the dollars need to be spent.
Okay, yeah, that's awesome. I mean, just to echo what Councilor Flaherty expressed earlier, I think inclusion of counselors or conversations with community and just citywide means that we're having these conversations and understanding a very transparent plan as to commitments, even if they're verbal. I understand that, Madam Chair, to your point, that basically, it doesn't speak necessarily to commitments, but rather, conversations to areas that it should go to. But the community or in certain groups are talking about specific dollar amounts. And so if you have a spreadsheet somewhere, a magical spreadsheet, a wish list of some sort that sort of correlates to what we've been saying to the community as a government that we will commit $100 million to this or to that. Can we talk about that? Can we have these earlier conversations and include the council in that, so we at least understand, sort of have a picture or a puzzle of the expectation from the community?
Sure, we can definitely try to pull that together. I do think, this is not the beginning. This is sort of the middle part, kind of like halftime of the conversation, where we're going to be coming back to the council for actual appropriation orders. So I think that's where you'll see sort of dollars to donuts, where we're sort of recommending the funding go. I think we're happy to pull together what the asks have been, but I think Casey, as she alluded to in some of the presentations, it has skewed really heavily on housing. We didn't really get into dollars specifically because it's hard to quantify it without actually knowing sort of where we want to put it. But I think when we bring a new proposal to the council for the remaining dollars, it'll be obviously very specific in where it goes.
Thank you.
Thank you so much, Councilor Fernandez-Anderson. I'll ask a few questions now, and then once I'm finished, if councilors have a follow-up that they want to ask, if they could just raise a hand, because otherwise I want to go to the public testimony that's been waiting. So I guess, one thing, and I've sort of flagged this a few times now, but it does feel to me extremely important that BPS is more directly in this conversation with the council. I appreciated, Casey, the information sent over by them and that you presented, but I think the reality, for instance, is that the way that BPS broke up their anticipated ESSER 2 and 3 allocations was by a series of goals with numbers next to them. And as much as it's helpful to understand their strategic goals, and I think many of them are strategic goals the council shares, fundamentally from a budget question, like the types of questions the council has to ask about ESSER funds are, what of this is being spent on one-time things, right, versus what's on staff capacity. And that has like an immediate direct impact on the city budget, right? Not just this year, because they're two pieces of a puzzle adding up together, but because any ongoing operating things, which the schools invest ESSER dollars in, we can fully expect that when the ESSER dollars sunset, those will want to come over to the city side budget, which this council appropriates. So I think it's really important that we get from BPS not just information about what it's trying to achieve with the ESSER dollars and sort of the buckets of like aspirational achievement, but actually like much more of a line item components and particularly that distinction, right, between like how much of this are we looking to spend on staff FTEs, how much of this are we looking to spend on capital improvements that are one-time things, how much of it is on outside contracts to do something. Like the council needs that kind of detail, and I think it is not too strong to say that the council can't possibly make final decisions either on the budget in Councilor Fernandez-Anderson's committee or on, other federal relief dollars without that in the picture. So I just want to emphasize that I think that because we don't have BPS with us today, I'm not really interested in putting the OMB team on the spot to explain in greater detail those buckets, because I just think structurally they're not being presented to us in the way that we need for kind of full oversight. So I think that it probably is going to require like a follow-up hearing on this docket in this committee just to really dig in on that. And I want to underscore, while Councilor Baker noted it, and it's true that the council doesn't vote on appropriations that are running through the school committee on these monies, like it's long-term City of Boston budget that the school department indirectly obligates. And, I think a lot of those things we're very excited about as a council, but we do have to understand them. And like Chief Sterrett said, I really don't want to set us up on any cliffs. And I think that when people in the community ask us, well, what's BPS spending its money on? It doesn't want us to just say, well, BPS is spending its money on literacy, inclusion, improvements to the school. Like people want to know, like, okay, well, how much of that is going to, improving my school's plan, or how many FTEs, or do you think everybody's going to get a reading coach now, right? Like, these are the things that people are going to want to know. And I would just stress that it's basically half of the discretionary funds that we're talking about here. And so I don't think high level reports are going to cut it for the council or this committee. So wanted to stress that at the beginning. And with that, I will bracket most of my questions about the details of how BPS intends to spend its ESSER funds. I wanted to ask quickly about just where you think we are on, you had those last few buckets that that we're sort of waiting on. I mean, there's Build Back Better, which is not a bucket that exists yet. We just hope that it will someday. But on the state funds, I mean, I am very antsy. Boston's 10% of the population of the state. I feel like as a baseline, 10% of the state COVID relief funds should be flowing to the city. In fact, I think when you apply an equity analysis and you look at those qualified census tracts, like more than 10% of the state's funds should be flowing to the city, because we have a lot of Boston's communities most in need. But I just wondered if you could speak to us about kind of what the funds expended so far in that category look like proportionately in terms of the amount flowing through the city of Boston, and what the kind of lobbying efforts on that front look like, or how the council could be helpful.
I'll start, or Casey, do you want to go? So I'll start, and I'll start maybe with the infrastructure one. So the charts that we went over today were really focused on dollars that come through the city's our financial system. Some of the dollars that are spent here in Boston, either by our agencies or by nonprofits or the community or other groups that don't hit us, still are felt here, but they're not maybe coming through us. So on the infrastructure side, those are going to be much closer targeted towards either any formula grants that we get for capital expenditures, or targeted infrastructure competitive grants that we're sort of applying for, and there'll be like transportation stuff, mobility stuff, water and sewer stuff. There'll be a whole list of different types of programs that we'll apply for. Those are sort of more prospective and haven't been finalized yet. So more to come on that. On the state recovery, not only would I say we have 10% of the population, we also generate about 20% of their tax revenue. So I always argue we should get 20% of dollars from them, but that's a different story. So what I would say is, again, similar to many of the dollars spent here, like ERAP, where the state money around housing is a good example of, they are open to Boston residents, but they don't flow directly through the city. So it's hard for me to give an exact dollar amount of what we've gotten from them. But I do think we have made our case up there. We recently got some specific funding in the last ARPA bill that came through around mass and CAS and other priorities of the city and the administration. But again, it's sort of a little bit outside of our books that these types of investments exist. And Build Back Better, I agree. Maybe I should take that one off, but it's definitely prospective. Still hopeful, I guess.
I think one example we can give it, and the small business team spoke to this in January before the council body, is as we are launching funds, so the Small Business 2.0 fund, we're really working in partnership with corollary funds at the state level to ensure that we're providing technical assistance about the state opportunities, and vice versa for those coming to the state who are in Boston, that they're aware of our opportunities as well. And so we're really asking our department partners to do that across the board when it comes to emergency foreclosure or rental relief fund. D&D is doing the same as well, because we do want to make sure that our residents are maximizing the opportunities for financial support, residents and businesses as well. And like Justin said, thanks to some partners, our partners at the State House, we do have some Boston specific earmarks to support some of the challenges that we have, as well as the additional like programmatic dollars that will continue to flow down from the state in the coming months and years.
And why don't you speak a bit on the ERAP side to, I mean, when you look and see that we've appropriated $58 million to the emergency rental relief and we spent 30.1, and obviously 50 of that 58 we were required to spend on rental relief because that's what it was allocated by the feds. And then we were ahead of everybody else in that we put that initial 8 in before, or at least 5 of that 8 in before everybody kind of got on that bandwagon. And I think we have right to be very proud of how quickly D&D moved on that and how much our program developed very quickly over the course of the pandemic and went through several cycles of improvement. So on the one hand, I look at 30.1 out of 58 and I'm like, oh, that's great. We got almost half of it left. On the other hand, I think my understanding is that that the state is rolling up its program faster than we are, and that therefore there's a concern that a lot of Boston families that have been getting rental relief from the state are going to find themselves without that support in the near term future. And so there might be a kind of like accelerated drawdown on the monies that we expended to that purpose. Can anybody on the call speak to that a little bit more?
I think we'd have to get back to you on that specific question in partnership with D&D.
Okay, yeah, I think it would be helpful for the council to understand, because again, you look at the numbers like off the top of your head and you say, oh, we spent half of it and we're, starting to come out of the pandemic. And I'm sure like that seems like we might be okay in terms of having enough resources for our families that are in these rental relief emergency situations. And then just that larger state picture has me a bit more concerned about that. So I'd love to better understand. And then I think the last time we checked back in December, just flagging on the FEMA front, you guys noted in your presentation that the lion's share of our FEMA reimbursements have actually gone to Boston Public Health Commission, so separate from that 14 mil. I think last time we checked, it was 28.5 mil that we thought that BPHC was going to get back. Do you know, Jim, if that's still roughly the number?
Yeah, that's about right. We just got an update the other day, but they're really pursuing it. It is a public health emergency, so you would expect them to be the largest claimant for FEMA dollars.
And yeah, and that's encouraging to me, because I was at first sort of discouraged that we weren't getting more from FEMA, but it's good to know that a lot of it's going on the BPHC side. Do you think, Jim, that we might be in the happy circumstance of needing a council authorization for any further dollars for FEMA? I mean, I know that we don't quite know how all the reimbursements are coming down. We've kind of authorized, as you said, up to 16, but it seems like there was at least a chance with the.
Yeah, it's entirely possible, and we might actually be coming for you for a snowstorm for Winter Storm Keenan as well. So, that still comes. So, both. I know schools was encouraged by a national organization to go back and relook at some things for potential FEMA eligibility. So we're going through that process, and hopefully, we're coming toward the ends of the COVID emergency health crisis, but there continues to be efforts there. But we will have other things like snow emergencies that will be coming to you regularly for. So. Yep.
Yeah, no, it's just always seemed to me like, I know it's tough because we don't like to spend money that we're not sure FEMA is going to pay back to us, but it's like, you just feel like without 100% reimbursement policy, like we should be finding every possible way to get that. And then I wondered if you could speak at all. I saw the note that with broadband that they had changed the standard such that it would allow broadband related infrastructure. It seemed like in a wider swath of the city, because it had been a very low threshold, and then it's been raised a bit to a kind of like, you have mediocre broadband, but not really what you need for class and work and all of the like things of modern life. So I was just curious, Casey, if we or whomever, if we have any like comparative map. Like you showed us the map of qualified census tracts, but I was curious whether like we have an internal sense of like what areas of the city the new guidance applies to as opposed to the old.
I don't have that in front of me today, but I'm sure it's something that I could work with Mike Lunch to pull. That was I know Mike and a lot of our federal partners were huge advocates to have U.S. Treasury make that change in the final rule. And I know many mayors across the country and urban cities were also advocating for it as well. So it was a kind of win for our urban partners. I think we would have loved to see it go even further, but the change in the final rule is a positive step.
Yeah, no, and I just think, as somebody who is interested in municipal broadband, like I would really like to understand what it actually means for us, like what areas are actually eligible. I'd also say there's a lot of conversation and a lack of clarity about sort of what parts of the city are deemed to have what speeds in general. And even though there's been a lot of work on that front by our Human Rights Commission and others, I think there's still confusion about that. So it seems to me like whatever we've got to do to figure out what sections of this that apply, like of the city it applies to, should be shared with the council. So I'd love that follow up. And then we haven't done anything with these funds in support of BWSC to date, correct? Yeah, I thought not. and with infrastructure, with broadband, we spent that $1 million on digital equity, but it was actually maybe not in that bucket. Is that right? Did we do any hard infrastructure work in the appropriation in June? I'm sorry, I should remember, but.
So there is about, I think it's $1 million in total for the Boston Housing Authority for expansion of Wi-Fi in the physical buildings. As well, there was $1 million for continued support of making city services accessible digitally. I think those are the two main buckets. Scott, remind me.
The BHA wiring one, which we spent, it was the 600 and then we had another 400. So it was, that $1 million, that would fall in the broadband hard infrastructure bucket. But I think the other one probably wouldn't, right?
Yeah, I will need to, I can't remember exactly what category we put that one under, because it still might not actually fall under broadband infrastructure category. I don't believe we put it in the broadband infrastructure category, even though it is in support of digital equity. I still don't think it technically fell under the definition of broadband infrastructure, the BHA investment that we're speaking of.
Oh, you think the BHA one didn't either?
No, I don't believe it did.
Yeah, because it's like starry stuff, so maybe it doesn't count. Okay. And I mean, I just wanted to say, I think another follow-up that we would like, and this, if this is one where it's not necessarily tomorrow, it's more like if you guys have, if there's a natural snapshot moment, like whether it's like, once you have actuals for end of February or something, like, I do think it would be helpful for the council to understand, as Chief Starrett alluded to, we were deeply involved in the allocation of that 81.5 million, thinking about how we were doing that in June. And really as well in the way the revenue replacement supported the budget. I mean, that whole kind of 149.5 million that's been allocated to date by the council out of ARPA dollars, obviously the council's been very involved in. And I do think it would be helpful for us to have some kind of tracker that says, this is the amount of that that's actually been spent. Because since those are multi-year commitments and it's unusual, right? It's not like an FY22 thing. So it's not it's not a gotcha thing. Like, for instance, we allocated money to launch the Green Jobs program, something I'm super excited about. It hasn't yet had its inaugural summer. So obviously it hasn't spent most of what was allocated. But I do think it would be helpful for the council to have a bit of a ticker of kind of like, okay, of these things that were appropriated, here are dollars that are out the door and here are dollars that are being stretched out over the duration of that period. It's also like, interesting and good to know that that period has actually been extended by 2 years, even though it has to be, fully obligated by the end of 24. Before, we thought it was going to have to be spent by the end of 24.
Great. I think one of the things we're really excited about, and thanks again to our Do It partners. So Councilor Bach, we have to report those spending figures to the feds every quarter. So we just submitted one at the end of January for all spending through the end of December. And basically, once we submit that report to the feds, our dashboard on the website automatically updates. So you then can click into, and any resident of the public can do this too, click into every project and look in Green Jobs and say, of the 3 million allocated, what's been encumbered or obligated or in contract, and what dollars have been spent too. And then we're also posting a PDF of the report on the website as well. So that's something that we want to remain accountable to the public about, and the council, of making sure that that's updated on a quarterly basis. And of course, we're working with our department partners to make sure that we're being mindful of projects where we'd like to see more spending, or we're worried about the pace of spending, and having those internal conversations as well. But really want to point folks to that resource, because it's the first time we've been able to do that, where it really automatically updates just in concert with the reporting that we're doing to the federal government on a quarterly basis.
Yeah, that's great. That's fantastic. Thank you, Casey. And then I think just a last, two last things. So the second to last one is just qualified census tracts. I think it would be helpful to for folks to have that map in a more accessible way, not just a snapshot, but like, something where people can actually click and see what number census tract it is and understand what's in it and out of it. Like, I think that is a reasonable thing for the council to want. And I'm sure that you have it. So it would be great to have that. And also to understand which programs we're actually targeting at qualified census tracts. Because it seems to me like obviously a great deal of the things we do that are focused on our Black and Brown communities, we're not necessarily doing through that mechanism because, you know, for instance, it would be like things that we're doing in the schools that where we've got a heavily low income and Black and Brown student population, but they're not kind of being run through a census tract type system. So I'm just kind of trying to understand what exactly of our interventions are actually running through that bucket that operates on the qualified census tract mechanism.
Great.
You're muted.
Just muted myself. I think great idea, Counselor, on the qualified census tracts. Our new urban mechanics team actually this week put together kind of a map for us that we can more actively play around with. And I think it'd be great to just add that to our website so it's available to the public and the council as well. And what I would say, and I think your point is really well taken, is that many of the kind of categories, what the federal government calls expenditure categories, are mandated to kind of fit into these qualified census tracts. And so that's kind of, you know, as we think about the 69 expenditure categories, there's a pretty clear indication which ones kind of have to fall into the qualified census tracts. But like you said, I think programs even that don't have that ticker next to them or that check mark next to them for qualified census tracts, that doesn't mean that our departments aren't targeting our disproportionately impacted communities, right? We just might not be using the exact federal definition that is kind of mandated through this legislation. So we could certainly report back on kind of what is federally mandated, which categories is federally mandated, but I do think it's important to note that that doesn't mean that projects that aren't in those categories aren't targeted towards those hardest hit by the COVID pandemic.
Yeah. And a quick question, Casey, for you on, Justin mentioned the infrastructure funds, but specifically, has DOT come out with like guidance on its various like pilots and such that are, you know, that are competitive in the infrastructure bill yet?
So it really is project by project. So even within the DOT kind of bucket of projects that they are covering, for the projects that were reauthorized or existing programs, those typically the guidance comes sooner. And so we've started to see some of those roll out, the bridge improvement program being one of them that was the first to come down to the state. But some of them, you know, they have said we will receive additional guidance not till even Q4 of this year. And then some programs, all we know at this point is it's a TBD on the timing for additional information for those programs. So we're really, you know, have to track on a program by program basis to ensure that we're up to date on the most the available opportunities and the expected opportunities that we can prepare for in advance. So it's a little more complicated than I think we all hoped.
Yeah, thank you to you for just like tracking that. It's a huge lift and it's so important, right? There's so many things where like there's a chance for the city to get significant resources, but we have to act fast and act in an informed way. And it's very tricky, so thank you. And I think those are all my questions. The only comment I wanted to make vis-a-vis some of the things that other counselors mentioned. I mean, I'll just say that personally, I certainly, over the course of the campaign last year, you know, had conversations with and made commitments. I was proud to support. There was an ask out from GBIO for kind of supporting $100 million in affordable rental housing funds, and then another $100 million in affordable homeownership. There was a $50 million request for support to Mildred Haley and that renovation and redevelopment, which I think the mayor's already committed herself to, although I think the question of how much of that is out of ARPA versus capital dollars probably remains to be seen, since that would be a capital dollar eligible expense. I think I recall also committing to a $1.9 million budget for the Office of Returning Citizens. And I list those things to speak only for myself and say that those are things that I recall committing to, but I think a number of councillors and the mayor did as well. So I do hope that those things will be in our conversation going forward, but I understand the administration not wanting to kind of pre-announce appropriation orders that it may put in, but I just wanted that on the record today. I think those are my comments, and now I'm going to go quickly to Councillor Braden and Baker, and then I really want to get to our public testimony. So Councillor Braden.
Thank you, Madam Chair. And again, thank you to the team for incredible information, a lot to digest. One of the issues that we're constantly encountering is just the need for good metrics and indicators to assist in decision making. And I was wondering, we'd like to see more data on the geographic distribution of where the funding actually landed by council district, neighborhood, zip code, census tract. Especially it helps us look at, it's almost like an indirect assessment of need. Food delivery, how many neighborhoods were needing that supplemental assistance for food access, and how what does the equity look in that situation? Testing, was adequate effort made for all neighborhoods? I know I had to fight to get testing in Alston Brighton. A small business relief in terms of the distribution of the small business relief across the city. In the FEMA funds, there was an additional. It'd be good to have some specific details on the additional details on the $1 million for emergency response consulting, and the $300,000 for immediate emergency communications. I remember in the first weeks of the emergency, we were mobilizing volunteers to do a lip drop in multilingual handouts all across the city. It would be interesting, and this is not the last pandemic. This is not going to be the last emergency we're going to face. What lessons did we learn from immediate emergency communications, and how can we take those lessons and improve our emergency preparedness going forward, so that we have a better infrastructure and a better way to disseminate information in the next emergency. And then, in this time of emergency, extreme weather events, etc., we should be really thinking about those issues. Then, I don't expect the answers to all these questions now, but I'm also curious about the geographic distribution of schools that got emergency funding for improvements in their air handling and ventilation. I know there's a huge backlog of, we haven't fixed our windows in decades. So the windows situation, it'd be interesting. I'd like to know just specifically which BPS zones, individual schools, council districts, neighborhoods, and zip codes census tract, to try and disaggregate that to get a better sense of what schools were the most in need and how the money was spent, and are there other outstanding schools in our district across the city that need further remedial action to help improvement of air quality. And again, thinking about the bigger picture of extreme weather events and extended heat waves, schools can be used as cooling centers. And schools, we're expecting hot weather in this earlier in the summer and later into the fall. So having this is an essential infrastructure improvement that will greatly impact the health of our students in our schools. The other question I had, and we don't think we dived into it much, was just in terms of the public health response, and really the piece that we're not talking about so much. We talk about it, but I don't have good metrics on it, is our response to the mental health, substance abuse, and crisis intervention, beyond the sort of headline grabbing. There's no doubting that the mass and cast situation is a horrible human tragedy and of great proportions. But there's lots of mental health challenges for our young people, our students, and our elders that are not necessarily grabbing those headlines. So I'd like some information on any pilot programs that we've tried to instigate and ways that we could extend some of that approach beyond the pandemic. And if there's any metrics being used to try and support a pilot program and then get some metrics of how this information might be used going forward. And I think that's all from me right now. Thank you. And this has been an amazing conversation. I think it's going to be an ongoing conversation over the next months, and hopefully we can learn a lot from this experience and build better in Boston.
Thank you, Councillor Braden. I don't know if the team wanted to say anything in response to any of that.
I'll just say on the data request, Councillor, around neighborhood distribution, council district distribution, and then the school stuff, we will certainly follow up. Some of that is readily available that we have on the website that we can share. As it relates to the mental health side of things, I think there are actually a couple different buckets of investments, both in the direct substance use crisis down in Mass-Cass that use federal funding, as well as recent operating budget investments, and actually in the BPS budget that they're going through right now, there's additional supports for student-based counseling, both on the clinician side and as well as on the mental health side. So definitely more to do there, but definitely has been some recent conversations and talks about that. And then absolutely agree that this is the beginning of a partnership. We really do look forward to bringing a robust proposal from the mayor to the council for consideration of everything we've talked about today, and we'll talk about going forward. So definitely more to come.
Thank you. Thank you, Madam Chair.
Thank you, Councillor Braden. Councillor Baker?
Thank you, Madam Chair. I'll be brief. Casey, on page 26 is where I was talking about. Slide 26. Under ineligible, it says congregate.
Yep. I think
congregate facilities, and then above it, where under eligible, it says childcare facilities, schools, hospitals. So where do we, can you just explain that a little bit?
This is just a summary of a 450-page, unfortunately for us, a 450-page bill. So I think this is, I think right there they were talking about, I don't know specifically how they're defining congregate here, but like I said, I'm happy to do some research on it and get back to you.
It seems like,
sorry,
go ahead.
Frank, forgive me for breaking in, but I don't know this, but my general experience is that usually when the word congregate gets used in this context, it's a reference to congregate housing, so shelters. That's usually how it gets used in federal.
That was my follow up into it. So that would also knock us out of the box for if we're looking to do supportive housing for what you're talking about, Kenzie, like for step up housing, that sort of stuff.
I believe actually permanent supportive housing is an eligible expense. They do think about shelters and permanent supportive housing as emergency shelters and permanent supportive housing as different categories of spend. Well, like you said, an ineligible expense is construction of a new congregate facility. They do allow for rehabilitation and kind of internal construction work on congregate facilities, but they do not allow a brand new one. So they do, even within how we think about homelessness and housing, differentiate across those categories.
Yeah. Okay. So thank you very much. I got my question answered. On page 13, we don't need to spend a lot of time there, but that is where I guess Mass and Cass would come up. And I would like to have some details, and I don't need them now. I've asked for them, sort of what it's costing us, specifically Roundhouse and the Envision Hotel, and maybe a breakdown of what's being spent down there between this slide here, slide 13, and also our general budget. And and again, don't need this stuff right now, but that's something I will be looking for. So thank you, guys. I appreciate that. Was a good hearing. Thank you, Madam Chair.
Thank you, Councillor Baker. And I think at least my understanding is that some of that funding you just referred to has come through COVID relief funds that run through the state. So they, although they're benefiting the city, they're not part of this, the pot that we've been discussing today. I think I'm seeing some nodding heads. So, which doesn't mean we don't want the specifics of how it's broken down. We do, but I was just flagging. I think it's out of a different bucket. Okay, I want to very quickly give Councillor Worrell, as my other co-sponsor besides Councillor Braden, just a chance for a last word, but then I want to go to the public. So Councillor Worrell, did you have anything?
Nothing at the moment. Great presentation, very informative. Looking forward to the public's testimony and working with the administration on making sure that the rest of the cities, trying to make sure that we get more respondents to the survey questions that are more representative of the city, and then working with them on passing the rest and expending the rest of these dollars. So looking forward to public testimony.
Great, thank you so much. And now we are going to move to public testimony. I'm starting with the panelists from Equity Now and Beyond Center to Support Immigrant Organizing. Then I'll go to GBIO, MAHA, Black COVID Coalition, and the Greater Boston Labor Council. So folks, will start moving everybody in bit by bit here. I'll just remind people, if you can just introduce yourself at the beginning of your testimony, that would be great. So that everybody watching knows who you are. And if you are watching this at home and you are not signed up, you are not affiliated with any of those organizations whose names I just read, you can still email Michelle, MICHELLE.A.Goldberg, GOLDBERG @boston.gov, and we'll get you the Zoom link and get you signed up. But I would just encourage you, if you are watching and you want to do that, to do so soon, so that we get you in before we gavel out. Let me just see if I've got everybody on my list here. I'm going to assume under Center to Support Immigrant Organizing, is that Kevin Whalen?
Yes.
Excellent. Kevin, let me just make sure that I get all your folks in, and then I will pass it to you. And I think Kevin will introduce his group, but they're just going to quickly give a series of short statements in an interconnected way. So I think everybody's in. Kevin, you have the floor.
Thank you, Councillor Bach, and thank you all the city councilors for being here today and for inviting Equity Now and Beyond to come testify in this important hearing. Particularly thanks to Councillor Louis-Jean, who alerted us to this hearing a couple days ago, and we were able to get some stuff together for it. So as Councillor Bach said, my name is Kevin Whalen. I'm one of the two co-directors of Center to Support Immigrant Organizing. Our organization, CSIO, coordinates the coalition Equity Now and Beyond, which is an immigrant health equity cohort that's led by Brazilian, African, Latinx, and Haitian organizations working deeply in their grassroots communities. Those are Brazilian Women's Group, ACEDON, True Alliance Center, and Haitian Americans United from the Haitian community, and Agencia Alpha from the Latinx community. We came together in late 2019, and since early 2020, we've come together to boost COVID and other health equity resources in those grassroots immigrant communities. We've worked really closely with the city, with Department of Health and Human Services previously, and now really closely with the Boston Public Health Commission to getting COVID resources out to, frankly, the communities who had the most difficulty accessing COVID resources. In the midst of it, we used our strengths as grassroots organizations to integrate COVID resources with other supports that we provided folks at the same time. We provided on-site health insurance enrollment, voter registration, immigration counseling, housing and worker rights support, youth, women's, and community development resources as well, and many more. We submitted some testimony, a couple pages of testimony to the City Council to kind of drill into the details of what of who we are and what our challenges have been. But I just wanted to quickly review some accomplishments of our cohort. We vaccinated over 5,250 community members. We've educated more than 60,000 community members in the native languages on COVID, the vaccine, via social media, TV, radio. We've distributed over 5,600 PPE kits, and we've combined our COVID vaccine clinics with education and support around workers' rights and housing and immigration and the like. So we're dealing with not just the inequities around COVID, but the deeper health inequities that face the communities. That's why we're called Equity Now and Beyond, because we want to deal with COVID now, but we want to go beyond COVID. Our panelists here today from Equity Now and Beyond, they each represent one of our grassroots groups, as well as Dr. Kohler from Children's Hospital, who's been a wonderful medical advocate for us. We've encountered a lot of barriers to getting these resources out to the immigrant communities, and we wanted to share them with you, as well as strategies on how to remove those barriers and move forward and improve immigrant community wellness. Folks from our cohort, I'm going to turn it over now to Damaris Velasquez from Agencia Alpha, and after her, Dr. Kohler from Children's Hospital, Claire Louise from ACEDON, Reverend Dufour Floresan, who everyone knows as Pastor Kiki from the True Alliance Center and Haitian Americans United, and Fernando Beniti from the Brazilian Women's Group. Each of us will take 1 point to make. So thank you, Councilor Bach.
Thank you.
Well, good afternoon, and thank you, Madam Chair and councilors, for giving us this opportunity. We're very excited to share with you some of our ideas, and at the same time to thank you for being willing to work with us. And something that we would like to inform, as Kevin was saying, is our cohort has been able to prove that we, the immigrant community, can be seen as the part of the solution. Part of the, as Justin started was saying before, we can be part of that budget challenges solutions that sometimes the city is looking for. So if you invest in our community, you will never regret it. And things that we believe that are important right now is investing in our community by providing us, COVID testing resources. And we're talking here about not only providing the vaccine, but also providing test sites together with the vaccination. We have the capacity as grassroots organizations to host both at the same time, keeping both of them separated enough so we wouldn't get those who are seeking to be tested or those who are seeking to be vaccinated to get contaminated with those who are seeking to be tested. So we do need those kind of sites. We have seen that sometimes when people come to be tested, sometimes when you talk to them, you can change their mind and they might then be willing to be vaccinated. So that's why we believe that we need to have both of those resources at the same place. And we also believe that, investing in us, our community, by increase the workforce development resources. For example, we ask our community, how would you like the city to invest in you? We're very thankful that our community has been receiving a lot of resources, food, help to pay their rents, but also our community has the capacity to be part of the workforce. It has the capacity to be part of the solution. And they always say, if we were to have the language, something so simple as being able to have access to ESOL classes, mothers who can't go to the classes because they have children, they don't have the money to pay for babysitting. So ESOL classes that provide not only the classes, but also babysitting services. We also need, for example, opportunities for our immigrants to have access to quality union jobs in the building and trades, green economy, technology, and other sectors. If you invest in our community by giving our community these skills, being certified or have some type of classes where they can receive these skills, then they become part of the workforce of the city. You're investing in people who are willing to invest in their cities where they live. That's part of the solution. For example, the fast track certification of immigrants who work healthcare of other professionals in their home countries, but don't have access to resources to access certification programs here in the United States. We see that program as a critical strategy to increase the resources of COVID vaccine providers and hospitals. We know that there is a big lack of medical professionals in our city right now. invest in those immigrants who already have these skills. They just need a little bit of push from the city, and then they will get back, not only to the city, but they will give back to our own communities. Thank you.
Thank you so much.
Thank you so much, Damaris. I'm going to take over. Thank you so much, Chair Bach. Thank you so much, City Councilors, for the opportunity, also as members of the public, for us to share some thoughts with you. My name is Dr. Julia Kohler. I'm a pediatric infectious disease clinician and assistant professor of pediatrics at Harvard Medical School. And throughout the pandemic, I've partnered with immigrant community-based organizations to support their work where they protect their community members, and that includes members of Equity Now and Beyond. My personal experience is that it's these organizations that are by far most effective in, for example, vaccinating their community members. And this is because they have the long-standing trust of their community members who know that it's these organizations that care about them, not just about bringing up some numbers. And then these organizations, their own organizations, have been supporting them as they lack housing security, as they lack food still 2 years in, as they lack immigration status, as they lack workplace safety and workers' rights, and sick leave even when they're infected with COVID. They have to go to work. They get threatened by their employer. Grassroots immigrant organizations are listened to and are credible when they provide accurate vaccine information and when they offer vaccine clinics and long-term health information, as I know from door knocking with La Colaborativa in Chelsea for 3 months with COVID vaccine information. When grassroots immigrant organizations have the resources that they need to do this work in the way that they know best, they're vastly more effective than, for example, any funds that were spent, for example, on campaigns like Trust the Facts, Get the Vax. It's these organizations that when they have the resources, they and the communities, their own communities, the resources that they've been starved for, that they can be effective, offer vaccination clinics that are actually accepted and taken up, and that people travel long distances to attend, as opposed to going someplace that they don't know, that they've never been to because they don't even have a primary care doctor. And there's many people in our city who have never been to the doctor in the 20 or 25 years that they have been here. So it is these organizations that can truly provide care, information, vaccines, and long-term health support to their own communities. So this is the most effective, and also I would add the most fair way to spend this money. And lastly, as a microbiologist, as well as a clinician, I like to say that this pandemic isn't over. We don't know whether and when the next surge is coming. And as was said, we don't know when the next emergency is coming. So as a city, I think we need to build the capacity to respond to our next emergencies, and also to support the long-term health needs of immigrant communities. Thank you so much again for this opportunity, and I'd like to turn it over to Claire.
Thank you so much, Dr. Kohler. Good afternoon, Madam Chair, councilors, all protocol observed. My name is Claire Louise Ocalan, and I am the Chief Operations Officer at ACEDON and a proud founding member of the Equity Now and Beyond cohort. Throughout the last 2 years of working together with our diverse immigrant populations, we share similar and unique characters, challenges, and in a silver-lined act, resilience. I have been witness to this through the quick assembly of our diverse communities to step up and act in humanity. And I would also like to recognize former Senator Wilkerson, who's also on the call. The Black Boston COVID-19 Coalition has also been a very tremendous support in our communities that we serve. What is essential going forward is to take the wins. We don't know where the next pandemic is coming from. One of these includes the presence of vaccine clinic wraparound supports and any health or wellness supports around health equity pieces within the communities. The COVID-19 vaccine clinics that we hosted in our immigrant communities were largely successful when these resources were present, and their absence denied key resources in terms of health and wellness related resources. I'll give an example of a person who got vaccinated, and as usual, we have to wait for 15 minutes. And this was from the Haitian community, a clinic in Mattapan. The person started to feel a bit funny, and when they checked, the high blood pressure was significantly high. We could have missed this person entirely altogether without those 15 minutes and without any support at that clinic. Who else are we missing at these clinics? Folks who aren't enrolled in any health insurance, folks who have pre-existing conditions that they don't know about, like Dr. Kohler said, because they haven't visited any clinician or any clinic, any health center in the last 10, 15 years. So providing these resources or apportioning these resources at vaccine clinics is crucial. What we, like Dr. Kohler said, what we do know is that a lot of folks don't have a regular PCP or they lack health insurance. They're also disconnected because of their immigrant status. We need resources in the form of trust building, but also to implement health literacy, gift cards for groceries and essential needs, flu vaccine and COVID testing stations that are easily accessible, walkable even in the communities, on-site health insurance enrollment and advocacy, because many of them are afraid the minute they see somebody in uniform, health screenings, wellness checks, health fairs, checking for diseases and afflictions that we know particularly affect certain communities, dental screenings, vision exams. So all these wraparound supports are definitely needed as I don't want to say prep for another pandemic, but just to make sure that we are ready when the next pandemic comes around. Thank you very much. And I will pass it on to Pastor Kiki.
Thank you very much, Claire. My name is Pastor Geoffrey Fleury-Saint Kiki, representing the Equity Now and Beyond HEU Trident Center and Immigrant Family Service Institute. So great to be with you. Thank you, Madam Chair. Thank you, all the councilors who take the time to hear our testimonials. I echo everything that was said in terms of inequities or social determinants of health that our communities are facing. But I'm just going to talk more about the other piece that affect most of our communities' health, which is the housing piece. Rent burdens that creates a big problem. The social economic support that our community needs is extremely vital. Just give you an example regarding some of the barriers now facing individuals to take the boosters. They're telling me that if they become sick after taking the boosters, they cannot take 3 or 4 days out of work. So we need to guarantee those workers paid time off when they become sick with COVID. Then we have a long haul of COVID. That's another situation that most of our communities are facing. We need to tackle this in beyond. So again, I would echo increase public transportation resources so people can be socially distant as they go to and from work and from school. We definitely need to keep COVID away from our communities. That's what we held weekly COVID-19 vaccination clinics 3 to 4 times and 5 times a week. We need to have enough inadequate resources to basically conduct those clinics and offering those other wraparound services to our communities. So the other thing also has to be with a rent burden. So not enough affordable housings in Boston. That creates a problem. 50% statistics prove Black and Latinos struggle to pay their rent. It's a very, very difficult. So thank you so much, the Resiliency Fund that has helped with rental assistance, but not enough. Many of our communities really never were able to be able to receive those funding. There was 100 applications of them. They called me all the time. They had applied. They were asking to provide additional documentations, and then they got discouraged. Some of them got evicted before, they could even get the help. So we need just those investment to be done in rental assistance and helping people paying for rent to that effect. But I would also add, we need help with people suffering mental illness. There's a crisis among Black and Latino communities when it comes to the opioid crisis. Most people think it's only the white communities. Not the white communities. But I'm inviting all of you just to join us later on at 7 o'clock. We'll have a discussion regarding that. We need the support for the state proposal to develop 75 to 100 units of permanently affordable, supportive housings. I call them supportive, stable, and then seeker housing, safe housing for those suffering from addiction at the Shattuck Hospital site. Number 2, we need to strengthen the inclusionary development program. We always talk about that by requiring developers to increase the percentage of affordable housing units. They must develop from its current level, 13% to 30%. We heard about 20, but we like that to be 30 to 35% and target these resources to very low income residents. And third, we are also very supportive of the efforts of the city and housing advocates to adopt a real estate transfer tax on luxury real estate sales, which could bring at least $100 million or more annually for affordable housing. We'll support the passage of that current home rule petition. I don't know if that's already done, but I'm sure there are very great progress on that. So in a nutshell, that's what I would like definitely to say. And let me turn it over to Fernando. Thank you.
Thank you,
Hello,
Pastor.
everyone.
Oh, there he is.
Hi, thank you. Hello, everyone. My name is Fernando. I am a member of the Equity Now and Beyond group and the CSIO, and also a representative of the Brazilian Women's Group. And I'm also a student at the Master of Divinity at Harvard University. So I'd like today to talk a little bit about a challenge that we face with disaggregation of racial data. So one of our challenges concern the fact that the community vaccination rates and other health information that we gather are documented by broad racial categories. For example, general labels like Black, Hispanic, Asian, etc. So
Sorry, Fernando.
access data from our target immigrant communities in a consistent way. Haitians, yeah?
Oh, no, for a minute you froze, but then we got it after, so sorry.
Okay, are you hearing me?
Yes, we're hearing you now.
Okay, so for example, as I was saying, Haitians will generally fall under the term of Black. Brazilians will fall under the general term of Hispanic, white, or Black. And migrants from countries in Africa will be identified as Black instead of Somali, Sudanese, Nigerian, Ugandan, etc. So we feel that our communities are not identified by the most useful categories of ethnicity, country of origin, language, etc. So as a result, we are unable to properly represent what are the rates of vaccination among Haitians, Somalis, Brazilians, and other immigration groups. Such data would enable us to steer COVID and health resources where they are needed most and would allow us and the city to access our impact in these target communities. So we have advocate the city to disaggregate the broad data of Black, Asian, Hispanic, and use resources from the COVID-19 funds to develop a system that identifies people by ethnicity, language, and other characteristics that help us to understand what is happening in the communities. So in sum, the idea is that the immigrant communities, the labels available right now are effective for US, like people who are in the US and US citizens, but they not really represent our community. So we urge the city to create systems of labeling our community in a more consistent way. Thank you, everyone. And I think that's it for me. I don't know if I should turn back to Kevin.
Great. No, thank you. Thank you so much, Fernando. I'll take it back, but thank you to everyone on the panel for your comments. And I did just want to say to Pastor Kiki's one of his points, the council did pass that transfer tax. And in fact, this morning during this hearing, the mayor signed it. Now, however, it goes to the State House. So I would just urge folks who support that to continue your advocacy to the state legislature, because we do need their support for that as well. But thank you to the group for both the testimony here spoken and also the submitted written testimony. We appreciate it all. And now I'm going to go to MAHA, represented here by their Executive Director, Simone Crawford.
Great. Thank you, Chairwoman Bach and members of the committee. Thank you for this amazing report that came out today. We appreciate everything that was said and all the questions that were asked were, poignant, and we're looking forward to the responses there. And thank you for the opportunity to speak to you today. My name is Simone Crawford, and as the councilor just said, I am the director of the Massachusetts Affordable Housing Alliance. I am their new executive director, and I am representing our large and active member base in Boston, and over 5,000 first-time home buyers who have graduated from our classes in the past 24 months. MAHA's mission is to educate and mobilize individuals and communities to break down barriers for first-time and first-generation home buyers and increase affordable, sustainable homeownership opportunities. Through education and civic engagement, we're committed to reducing the racial homeownership gap in Boston and throughout the state. Federal ARPA funding provides us with a tremendous opportunity to address the racial homeownership gap in Boston and again throughout the state. A gap that exists as a direct result of long history of racist discrimination in housing policy and structural racism throughout our economy and society. Right now, the racial divide is stark. 69% of white households in Massachusetts own their homes. That figure is just 35.4% for households of color. That means our households of color are being disproportionately impacted by ever-increasing rents, building sales, and other housing crises that results in homelessness and displacement from our communities. We are thrilled that Mayor Wu has publicly committed during MAHA and GBIO community forums to spend $100 million of Boston ARPA dollars on affordable home ownership. We are excited that over the past few weeks, MAHA has met with 10 of the 13 city councilors who have all publicly pledged their active support for this. And we look forward to meeting with those we have not had the pleasure to speak with yet. Homeownership is a fundamental building block of family safety and security. Housing stability means better educational outcome, less stress, and better health. And homeownership is good for neighborhoods as well as individual households. Owner-occupied housing means better building maintenance, safer streets, and increased investment in community building. We at MAHA propose the following uses for this $100 million ARPA Boston funding. the homeownership portion would be broken down in $10 million for the Stash/Boston First Gen Match Savings Program for first-generation home buyers. This program currently provides $5,000 to Boston home buyers who save $2,500 over the course of a year. With ARPA funds, we could increase the match to $20,000, so it would become a 10-to-1 match. If they save $2,000, they get $20,000, and targeted to home buyers whose parents have not owned a home or lost their home due to foreclosure. To date, 96% of participants are home buyers of color. Number two, $20 million for the One Plus Boston program. This program builds on the One Mortgage program, provides up to $50,000 per home buyer in additional assistance for interest rate subsidies and down payment assistance. To date, 70% of the program participants are home buyers of color. And last but not least, $70 million for home construction subsidies. The bulk of this $100 million should be used to increase the supply of affordable homes in Boston. It costs far more to build a home than most first-time and first-generation buyers can pay. These funds would be used to fill that gap. Some of this money could also be distributed through lotteries to home buyers who would then use the cash to make a market rate home affordable. Grants could be anywhere from $100,000 to $250,000. Some form of modified deed restrictions could be placed on those homes so that they would become part of Boston's affordable stock for an agreed upon time period. These grants offer home buyers more choices. However, they do not increase our housing supply, which is extremely constrained at this point. We will be happy to engage with the city councilors and the mayor's office of housing to hear their suggestions on this. Now, while the housing situation in Boston is especially dire for our Black, Latino, and Asian neighbors, we know that home prices in the city are well beyond the reach of a very large fraction of all working families, as well as the young professionals that our employers need to recruit and retain. This is a social and racial justice issue. It is also an economic issue for the greater Boston region. We're attracting a lot of jobs, but we don't have anywhere near enough starter homes that low to moderate and middle income workers might take those jobs they can afford. The flood of life science development proposal threatens to further overwhelm our inadequate supply of homes. We need this infusion of $100 million from Boston's ARPA money. We also need $500 million in state ARPA funds for the homeownership that Governor Baker proposed. The legislature allocated $180 million in round one. We welcome the opportunity to work with you to increase that by $320 million in round two. We appreciate so many of you who have already pledged to partner with us locally and in the State House. I thank you once again for the opportunity to submit this testimony. And if you have any questions, please contact me at my email address, scrawford@mahahome.org. Thank you very much.
Thank you so much, Simone, and please do submit the written version of that testimony as well. We'd love to have it on the record.
You're welcome.
Next is Phil Jones from GBIO, and then Diane Wilkerson from the Black COVID Coalition. Phil, you have the floor.
Thank you. Thanks, Councilor Bach, so much. And thanks, councilors and everyone who's already spoken for sharing and for giving us a little bit of time here. And glad to hear the questions earlier about what GBIO's priorities were. Excited to be able to reintroduce it. I live at 8 Barrow Street in Alston, and I serve on the Housing Committee of GBIO. We're 60 plus houses of worship, along with housing justice organizations, including MAHA and labor organizations. And we had a really good series of mayoral forums last fall, along with the city councilor forums. And the commitments that we got were, for a reminder, $200 million of COVID relief money being set aside for affordable housing in the Boston area. Half of it, $100 million, for home ownership, the same amount that MAHA is asking for, and the other half for stabilizing the affordable rental market. We also asked for a commitment for an additional $50 million for renovations at the Mildred C. Haley public housing units in JP, and thanks to the mayor for already committing to that. We had the $1.9 million for the Office of Returning Citizens, and we had the expansion of the wraparound services at Mass and Cass, providing more mental health supports for that population in addition to the supportive housing. and interested in working together on that too. The biggest chunk, far and away, is that 200 million being set aside for housing. And really, we're pleased in the fall to get yes commitments from almost the entire council for that 200 million. Now we need to see them delivered. We did our own listening sessions in 2021 with people from everywhere from Bethel AME to Temple Israel to Union United Methodist to SEIU 1199. We heard from 1,500 people in our listening sessions. I noticed the bar graph that was shown earlier of the city's own listening sessions with housing as 40% of respondents' top priority. That bar pops. When GBIO did listening and we asked our people what they need, it was the top priority for about 60% of our people. We represent a big interfaith, multiracial tent, but one thing everybody's got in common is a strong and passionate wish to make their home here in Boston and to know that their neighbors are secure too. And so really glad to be working with MAHA in renewing that commitment for the 200 million to be set aside, with 100 million being specifically for home ownership. Really happy to work on asking the state to increase their funding, happy to get down to brass tacks on exactly how that 200 million gets allocated, but want to make sure that upfront amount is secure, and very happy to send our scorecard with exactly which councilors committed to what around later on as well. Thank you so much.
Great, thank you, Phil. And yes, we would accept any written testimony, any materials you can send our way to the committee. That'd be great.
Absolutely.
Thank you so much. And now former Senator Diane Wilkerson, you have the floor.
Thank you, Madam Chair. I hope you all can hear me. I'm in a hotel in New York for my granddaughter's birthday, and I hear drilling in the background. So I'm hoping it is not distracting. But Madam Chair, I want to say good morning. This has to be one of the most informative city council hearings I've ever attended, and I've attended a lot, a lot.
Thank you.
It really has been, and I want to thank the co-chairs. I see Councilor Royal and Councilor Braden are still here. I am one of the co-founders of the Black Boston COVID-19 Coalition, and I'm not going to spend a whole lot of time talking about kind of the background, because I do want to focus on recovery, but I do want to share with you that we are getting ready to roll out what we believe is a seminal report. And just talking to the thousands of people that we have encountered in the last 23 months on particularly Black and Latino communities on healthcare and their relationship with our healthcare institutions. Dr. Julia, so much of what you said is so on point, and I appreciate that. We, in the last, I'm going to say 23 months, have done close to 84,000 wellness checks on residents targeting 5 communities: Roxbury, Dorchester, Mattapan, Hyde Park, and Roslindale. We have moved almost 60,000 mostly Black, Latino, and Asian residents to vaccination sites, starting from a year ago, back in February of 2021, when we started this whole process at the Reggie Lewis Athletic Center. And I would say well over 100,000 residents from those same communities to testing, and some double testing. And we learned so much in this process that you've heard about today. But I do want to just to point out that the city of Boston has been, and I'm talking about the Boston Public Health Commission, the Boston Office of Health and Human Services, as Kevin said, when we started this, it was really HHS, but BPHC has been it's so incredible partners in this, and probably even more appreciated and more so because the state has been so distant and so tough and lacking, I think, in the kind of support that we should have and could have received. And so to the extent that that point has been made, I would only echo it. Casey Brock Wilson, first her shepherding of the BRF and really allowed us to be involved as trusted partners. Again, Doctor talked about that and how this was so different from the way that the state tried to even support when they wanted to be, just couldn't quite understand that they weren't going to be able to do it effectively unless they worked with us. Whereas the city said, come on in, we want to learn from you. And our relationship has been incredible. And when it's not, we complain, but when it is, I think we should acknowledge that and really want the council to know that they have been on the ground in ways that really are responsible for Boston being the league leader in the state, and then our state being a league leader in the country, that everyone's looking to try to figure out, how we are doing so well on vaccination and testing. And yet we still have these pockets, like in Mattapan, where just over 50% of the adult population have been vaccinated. And so we get scared when we hear you talking about rolling back in the administration type of rolling back mandates and vaccination mandates. And so because people then behave differently with a community that we just barely got over 50%. So I want you to know that. And then but today, this COVID-19 recovery conversation, I hope, points us in a different direction and a more broad direction, the kind that you've been talking about, because it really is about what we do next, even though we know that we're probably not done with this. So I just want to share with you really two major points about why we are so concerned and focused on making sure that the vulnerable communities, the most impacted communities that the President Biden says and the governor says and then the mayor says, the former and current, need be focused, that we feel like that really has to double down. One of the most startling statistics that we have experienced in the last 2 years, and we have many, is that things have been tough for everyone. But since we started counting COVID hospitalizations and testing and vaccination and deaths, Black Boston has never spent one single week off the top of the charts. We've never been a number 2. We've never been number 3. Since we started measuring in April of 2020, every single week, Black Bostonians have suffered deaths at a higher population than our presence in this population in the city. That is scary, frightening, beyond measure, indisputable, not my stats, the city's stats. We are 24% of the population. I'm not sure we have ever been under 32% of the deaths. We are the only population that has, like I said, not only stayed at the top, but has consistently been dying at a higher percentage. No other population, not white Boston, not Asian Boston, not Latino Boston, Black Boston. And so that has to be a top of mind. The other thing is that we have, if you can imagine, in 23 months, lost 2.1 years on our life expectancy. I'm talking about Black Boston, Black Boston. And so for me, I think that we don't have to do a jiggle and a dance to make an argument for why that population ought to be the focus of our intent, not exclusively, but disproportionately targeted in any discussion around recovery. And so I would remind all of the counselors, and I'm saddened that the administration is gone, because one of the things that we heard was this commitment from both of the candidates in the course of the campaign for $100 million to Black Boston. We can debate that, whether what the number is right. My concern is only this, that in order for us to be able to begin to set things right for real, I'm really asking the city council to do something bold, to make sure what we do is bold. And we'll talk offline. I would love to talk, to meet with everyone about what that is, because there are different ideas about what we should do. But you have to be willing and able to do something bold. That's the thing. We can't just use this money to fill in for things that we used to do, or to replace monies that were lost, because we didn't start in a good place, right? Before COVID, we were already circling the drain. And so we have no desire to get back to normal. So I just have three things that I want to say really want to leave with you as a suggestion and a question. One, we have really detailed information from the city with who they spent money on, right? Then when we talk about the Boston, the housing money, the school money, we have detailed information about who they spent money on. We have almost no information on who they spent money with. And we had to come to this city council a year ago, and then a year before that, to get the data on how we're spending this money. And so, yeah, it's nice to know that 39% of the rental relief money was spent in Dorchester, because people are going to say, well, I think that was actually the response to Chair Anderson's question to Chief Starrett when she talked about concern about where he said, well, 39% of the emergency housing money, the rental money, was spent in Dorchester. And because we know that's not spending money on Dorchester, that's spending money to pay the landlords, who I'm going to bet you the majority don't live in Dorchester. Paying rent is an essential part of the support that for the relief, but don't get twisted. That's not an injection of revenue into Dorchester. That's not an injection of revenue. That doesn't protect these first responders and the first line employees that we are talking about, who live in Mattapan, and only 56% of them are vaccinated because they're distrustful, right? Because they're concerned, because they can't afford to risk getting sick so they don't go back to work. So the health disparities have been exacerbated. Home ownership is something that we can do, and housing is important. And then the economy, what has happened to Black and Latino businesses, you cannot ignore. You cannot ignore. The city will tell you, we've given X number of grants, but they won't do business with them. You want to talk about something sustaining and long-term? We need to be focused on that. And so I'm going to stay on it. I really appreciate that you have spent this kind of time. And for those of you who stayed, it is so important. But we have to be able to use this money in something that is sustainable. I so appreciate the questions that you are focused on, because you are hitting right on it. Food insecurity is real. It didn't go away. It is ironic that we're meeting on the 4th of March, because I am of the mindset or the memory that our schools shut down on March 4th, 2020. It's when the lockdowns began. And a lot of those kids came back to school. You talked about student money, and we had questions about that. I'm so glad you pressed that, Madam Chair, because what they didn't come back with was a plan for how to deal with the mental health realities for the students. They barely had a mask plan. So if you all don't stay on top of this and kind of shepherd, because it is connected. If you're talking about health disparity, they're being exacerbated, but please keep asking those questions. And please keep asking the questions. In his absence, I thank Chair Flaherty, because he was very responsive when we asked questions right after this committee was created. It is in good hands with you, Madam Chairman. You're asking all the right questions, and we want to see something that is done with this that's sustainable. And we think we can do it, and that targets the most vulnerable community, the most highly impacted. And we know who that is, and we can really do something incredible here in Boston. I think only if the council stays on it. So thank you.
Thank you so much, Senator. Yeah, thank you for all those remarks and all your work, and to everybody who testified, and to the counselors who are still on, the counselors who were on. I wanted to say that there is quite a significant community funeral happening today. And so a number of my colleagues reached out to say that although they had to jump off, they are definitely reviewing the rest of the tape. And it was just a tricky overlap with that today. And I also do want to thank Casey Brock-Wilson from the administration for staying on to listen to the testimony, and everyone in the administration, Chief Starrett, Director Williamson, I think Scott Finn is still with us. Thank you also, Scott, for staying on. And everybody behind the scenes who prepared that very informative deck for us today, because definitely the work is ahead, and I think it's only going to meet the promise of what Boston can do if community and the council and the mayor's office are all in conversation about these funds, and the appropriations that come out are coming out of that conversation. And so I think this was a good grounding for that ongoing conversation today, and I just really appreciate everybody who participated in it. So lots more to come. Thank you all. And with that, I think we have heard from everybody who had signed up to testify. So I am going to adjourn this hearing of the Boston City Council's Committee on COVID-19 Recovery. So the hearing is adjourned. Thank you.
Thank you, everyone. Thank you.
Thanks, Councilor Braden. Thanks all.